Senator Finley.
Good morning. Lynn Finley, State Senator, District 30, encompassing 36% of the east side of the state of Oregon. I'm happy to be here. Thanks for not requiring that I drive to Salem.
And anybody else on the phone that would like to introduce themselves?
This is Sarah Gelser, Senator from Corvallis and Albany, Lomas.
Senator Knope is also on the line, Senator from Central Oregon, representing Bend, Redmond, Tumalo, and Sun River.
Lori Monis Anderson, Senate District 25.
Welcome, Senator Gelser, Senator Finley, Senator Lori Monis Anderson, and Senator Knope. Welcome as well. I'm glad you're able to participate remotely. Just a heads up for those of us that are here and also on the phone, there will sometimes be a little delay in the conversation we're hearing online, so please allow a little bit of space in between conversations would be helpful. So we'll go around the table now, starting to my right.
Good morning, Janelle Bynum, State Representative, House District 51, East Portland and North Clackamas.
Good morning, Greg Barretto, State Representative, House District 58, Wallowa County, Union County, and part of Umatilla County.
Good morning, State Representative Andrea Salinas from House District 38, Lake Oswego, and Southwest Portland.
Good morning, Raquel Moore Green, State Representative, House District 19, South Salem, Turner, and Almsville.
Representative Paul Evans, Monmouth Independence, West Salem, South Salem, close to here. House District 20, also here because of interest in emergency preparedness as chair of the committee.
I'm State Senator Denise Bowles, Senate District 10, portions of Marion, Polk counties, Salem, Almsville, Turner, Independence, and Monmouth.
State Senator Elizabeth Steiner Hayward, Northwest Portland, Beaverton, unincorporated Washington County, and I think I'm here because I'm also a family physician.
Senator Boquist, District 12, portions of Polk, Marion, Yamhill, Benton, Washington County, 6 voters in Lane County, and like good Representative Evans, sit on the Homeland Security Council and on the Emergency Preparedness Committee.
Senator Arnie Roeblen, Senate District 5, parts of 7 counties, starting with Coos, Douglas, Lane, Tillamook, and Lincoln, and then over to Polk and Yamhill counties.
And I'm State Representative Paul Holvey, and I represent District 8, which is South Eugene, the Fern Ridge area, and Notai, Walton, and Lorain, all within Lane County. So I appreciate everybody being here. As you know, we're just like everybody else in the world, we're trying to comply with our spacing and trying to also get our systems up and running for being able to have people participate remotely. There's definitely going to be some challenges as we move along, but we'll probably be doing more remote conversations and meetings as time progresses. Again, I know there's been a lot of concern, a lot of attention to this as we're in uncharted territories with this latest pandemic virus that is expanding rapidly across the state and across the country and across the world. So we are here today just to get started on understanding where we're at, what the needs of our communities are, and where the legislature can plug in to help this coronavirus response. This committee has got a specific charge, and we'll get into that in just a moment, but the charge is not to direct the coronavirus response as such. We are here to help enhance that coronavirus response and try to do what we can and suggestions that come to us to make it a more effective response and try to mitigate the negative impacts, especially to vulnerable populations, low-income wage earners, low-income workers, other low-income populations, as well as small business. And we're going to have to go through a lot of materials. We have a lot of input, and we want to receive that information and input and try to triage it and categorize it and make determinations on what needs to be addressed first as a more immediate emergency type of response, where we can fit in with the gaps that will be needed by that response, and provide any sort of legislative resources we are able to recommend, and to also look at other policy issues that may help mitigate the spread of this disease, and also protect our communities and families while they are most likely and hopefully staying at home through this process. It's important that we keep parts of our economy functioning, our first responders, our supply chain for food, and especially our healthcare workers are absolutely critical in this response. And so we need to be able to help plug in any gaps that the response is having with resources, if we have them available, and trying to figure out how we're going to do that moving forward. This committee will have a couple of different charges, and it will be an ongoing and probably ever-changing subject matter as we respond to changes that are happening in our communities. But we are going to be looking eventually at the long-term economic impacts and actions that we can take to mitigate those impacts. But I think initially we have some urgency in trying to address some very immediate impacts that will enable people to stay safe during this pandemic, and provide resources across the state to help achieve that. So that is, you've probably all seen the letter that the presiding officers, when they created this committee, providing us with our charge. And one of those charges is identifying actions that will support that economic relief and household stability that we just talked about, and to produce budget and policy recommendations for the legislative action that we understand we may need to do fairly soon. We also will be trying to understand what is going on with the response and how we can help in that response with our resources or statutory changes. I know there's a lot of conversations, a lot of different ideas. I think it's important for everyone to know, including legislators, that we need to help centralize this conversation. It's good to have conversations, but if you want the legislature to be able to consider those conversations and those ideas need to come to this committee in some way. It doesn't do any good to have parallel conversations trying to address things independently of the governor's office and this committee. I believe the governor's office is one avenue to engage with, as well as this committee to understand the problems. We want to identify problems. If people have solutions, to suggest those things, we will be trying to triage all that data and information and try to pick off what needs to be done immediately as quickly as we can, and then move on to other topics as they may not have quite as the immediacy needed from that. So this is going to be a busy committee. It's likely to be meeting on Friday. It hasn't quite been set again yet that I'm aware of as far as the time, but we will follow up with that. And I just encourage everybody, to remain calm through this, but really pay attention to, the guidance and the executive orders that are coming out from the governor's office. They are positioning the state in such a way that I think we have a good framework for a response. We just need to figure out how to engage the necessary resources and people to make it as effective as we can. So that's sort of what I want to start with, and let my co-chair also make an opening remark as well.
Thank you. A couple things. First, if you're out there listening and you want to get us input, we will keep open this committee until 5 o'clock tonight, so you can send in the stuff to us. We'll give you those addresses as we get closer. But if you email it to our committee staff, you can go online and look at OLIS, and you can get a lot of the information. You can see that already 50 people have responded or so. So we will be reading all of that and keeping that in mind. I want to be clear from my perspective. I've had an opportunity to talk to all 10 or 9 of our Senate members over the last couple days. We'll continue to keep that communication open. I appreciate the fact that this is not a partisan issue. My members have been exceptionally good at keeping me informed. Hopefully I will do as well, keeping those members informed. I know that my co-chair is doing the same in the House. We are the legislature. Our job is to look at policy, pass those policies through bills that allow us to get roadblocks out of the way of the executive branch to support their efforts to solve the problems that we have with this virus. We are also the budget of the state, so we have to figure out what it's going to cost and how we're going to budget that, and that means more and more conversations that are going to have to happen amongst us about how to spend that, when to spend that, and how to spend that, because we know that not only is this an economic disaster currently, and there's people that are not working, but we're going to have to recover from it. And in Oregon, as most people know, our budget is based on money coming in through the income tax. There are not people working. Our income tax is going to be less. Therefore, having ability to do a response when we're done with this pandemic is going to be very important. So we are going to have to make very, very strong policy decisions on budgets and the policies that we look at changing over the next little while. And some of those will be emergencies. The only way we can do that is if we call ourselves or the governor calls us into special session. We can have these conversations and meetings, but in order to change policy and work on a budget, we're going to have to figure out with a special session. It is our job in this committee to pull together all of the ideas out there and come up with the policies that are going to drive that special session. So we need to figure out amongst ourselves those policies and have that open discussion in front of all the people of Oregon, so they understand that we're working hard to make those things happen. I am privileged to have been given the opportunity to co-chair this with Representative Holvey and my friends from the House, but I will see my position as clearly articulating what we need to do from the Senate perspective, combined with the House perspective, and hopefully we can demonstrate as a committee that we're here to take care of Oregonians, and that's what we're here to do, take care of Oregonians. So thank you for the moment to talk.
Thank you, Senator Roblin. And for those who may not know, he mentioned OLIS, which stands for the Oregon Legislative Information System, is where you can find information about this committee. The email to submit your issues or thoughts or solutions to this committee is jscvr.exhibits@oregonlegislature.gov, and we will, if someone reminds me, repeat that towards the end of the meeting as well for that.
I'll say one more little thing.
Go ahead, Senator.
You know, and Representative Holey mentioned this before. The reality is, right now, if you are concerned, and anybody who's my age or older should be concerned, there's a few of us that are in that critical risk, and I also have type 2 diabetes, so that puts me in another part of the risk category. We need to stay away from people. If you don't want to get the disease, stay home. I mean, just be in your house. And many of us who are retired have the opportunity to do that. I had the opportunity to come here and be with all these people. I've been taking all the precautions I can. We've got hand sanitizer. We have cleaned our desks. We are doing the kinds of things to take care of ourselves because I don't need to be taking a bed in a hospital. And if you're out there listening to this committee, hopefully you're listening at home by yourself. You need to make sure that you take care of yourself and don't expose yourself to this virus because we are going to have enough people who are getting it. You have complete control over your life and your kids' lives if you keep them away from parks and keep them at home with you. You have a chance to resolve it for your own families. I encourage everyone to resolve it for their own families.
Senator, sorry, Chair Holvey.
Senator Steiner Hayward.
Thank you. Just to add on to that a little bit, even if you yourself are not in a high-risk category, you have a responsibility to protect the people who are. So the rules about staying apart from other people physically apply to every single person in the world, basically, but certainly in this state, in this nation. And, you know, my 20-something-year-old daughter could bring home something that would infect me and her dad, and that would be a problem. So the younger people who are not themselves at risk for serious illness, if you're not taking the precautions that you need to avoid contracting it and potentially even being an asymptomatic carrier, which we know that there are people, then you are putting other people at higher risk. And you have a responsibility to be equally careful as those of us who are in high-risk categories.
Thank you. It's good to remind people of those social distancing measures and just broadly how to react to this virus, and we'll probably return to that a couple times. I will say that we're going to get started here with some presentations, and the governor's. Oh, Senator Bowles.
Thank you, Chair Holvey. Quick, somebody just texted me, was asking if the microphones could be muted unless we were speaking, because apparently it's really loud as it's translating out into the...
I also say just if you, the rustling of laptops and things like that, or the wrappers overwhelms the speakers, or the speaker's voice almost. So.
I don't know if that's possible. I just
we'll take that up
at some
technical
point. Suggestion.
I don't know that that's possible with this antiquated system, and maybe it's not that antiquated, but we'll try to do the best we can with staying quiet if you're not speaking. Thanks for that. It's a good reminder.
Just one more like housekeeping. So we have the cameras in the room, and they're being operated by our media folks downstairs to try to zero in on the person speaking. But they also catch everything on your computer monitors, and just a heads up.
So I will say in looking at the big picture of this issue, the governor has also convened a Coronavirus Economic Advisory Council, which is going to be working in concert with stakeholders and agencies and talking about some of the issues they have and what their recommendations will be. We'll be also hoping to get recommendations from the governor's office on things they see the legislature needs to take action on, whether it's statutory changes or regulatory flexibility or direct revenue to prop up some of the services that we're going to need, as well as trying to provide financial stability to those that are losing their jobs. And so that's been very helpful, and I'm really looking forward to listening to where the governor's office is at the moment and where they're headed, and how this committee and the legislature as a whole can plug in and try to take action to help address and slow down this virus. So with that, I think I'm ready to move on to some testimony that we have invited. And we're going to start off with Nick Blosser. And he's going to pop up on a screen here, I believe. Technology will take us a few seconds, so there will be some delays here and there.
I am here. Can you hear me, committee?
Yes, we can. So Nick Blossers, the Chief of Staff for the Governor's Office, and Nick, I'll let you just take it away from there.
Okay, I'm happy to start. I can see myself on a camera, so maybe you'll be able to see me in a moment. Co-chairs Holvey and Roblin and members of the committee, for the record, my name is Nick Blosser, and I serve as Chief of Staff to Governor Kate Brown. We have a coordinated set of remarks for you all on behalf of the executive branch and on our response to the current crisis. The governor said earlier this week that while it may seem we are in the middle of this crisis, in terms of impact and timeline, we are really just at the beginning. So first, I want to give you a broad overview in a few minutes of the actions taken to date. In terms of emergency response, we have established a unified command structure for the COVID-19 crisis using an all-hazards organization structure to ensure all capabilities of state government are leveraged. There's about 60 people right now in the Emergency Coordination Center in Salem working on this right now. This structure is based on the National Incident Management System, which is the same structure that would be used for a Cascadia-level earthquake response. It's a system that all of our first responders, healthcare workers, and emergency managers have been trained on and have exercised for decades. Andrew Phelps, the Director of the Office of Emergency Management, I'm sure would be happy to answer your questions at a later time if you have them. In terms of hospital and healthcare response, this is generally managed by the Oregon Health Authority and is coordinated with the ECC and the major hospital and healthcare systems. Oregon Health Authority Director Pat Allen will be covering this in a few moments. A major focus of the governor and her office right now is on supporting the health authority in increasing testing capacity, increasing the supply of personal protective equipment, and increasing and preserving hospital capacity. The governor reminded Oregonians earlier this week that there is no vaccine and there is no medicine to treat COVID-19. The only thing we can do is significantly reduce transmission of the disease through social distancing measures to reduce transmission and preserve hospital and healthcare system capacity. This is what is referred to as flattening the curve. Many of the actions the governor has taken in the past 8 days have been to follow this advice of the public health professionals and the Federal Centers for Disease Control and Prevention. These actions include a series of executive orders and agency actions on the following topics: declaring a state of emergency, restricting visitation at congregated care facilities throughout the state, prohibiting large gatherings and closing K-12 schools, issuing guidance for homeless shelters, closing visitation at the Oregon Youth Authority and Department of Corrections facilities, stopping abnormal price disruptions, prohibiting on-site consumption of food and reducing the large gathering size further, and requiring school districts to assist with meal distribution and the provision of child care for healthcare workers and first responders during the closure. In terms of coordination with the federal government, the governor has participated in weekly calls with the administration, usually led by the vice president, and we have had multiple points of contact with the CDC, the Department of Health and Human Services, the White House, and other federal agencies. For the most part, I will say they are being very responsive in getting back to us, but there are clearly shortages of needed items. In terms of briefings, we have been holding daily briefings for legislators and the congressional delegation. We have started regular updates for local elected officials statewide, including mayors, county commissioners, and other electeds. In terms of state finances, Debbie Koreski, the governor's budget director, has been working with our state CFO, George Naughton. Discussions have started between the various fiscal and revenue offices in both the legislative branch and the executive branch, and we have proposed establishing a coordinated group to work on statewide financial impacts, including increased costs and reduced revenues. This would include the legislative fiscal and revenue offices, along with the CFO, the Office of Economic Analysis, and the Employment Department economist, along with our Council of Economic Advisors. We expect to have joint recommendations from this group, and we also expect to keep the judicial branch and members of Congress informed on this effort as well. The governor has also established the Economic Advisory Council and a Critical Supply Chain Task Force, and Leah Horner and Christian Gaston, my colleagues, will have further updates on this effort shortly. The governor is also currently considering or reviewing policies covering several other areas. These include a policy covering colleges and universities in the state, directives related to increasing the collection of personal protective equipment, directives around expanding the testing criteria so more people can get tested as our testing capacity ramps up, and other agency-related things, for example, directives to ODOT to suspend enforcement of various driver, vehicle, and trucking industry requirements. For example, recently expired vehicle registrations and driver's licenses. So just to sum up where things stand right now, we are focused on 3 urgent healthcare-related items: testing capacity, hospital capacity, including the capacity of the healthcare workforce, and the supply of personal protective equipment. Then our broader focus for Oregonians is on 3 things: food, housing, and business and economic preservation. To conclude my remarks, there is no question that economic activity has plunged in recent days. Forecasters are putting recession in baseline assumptions now. According to the state economist, it is still too soon to know the full extent of the economic damage as solid data remains weeks away. And until the public health situation improves, the economic damage will continue to mount. A full revenue forecast update will not be available until May 20th. The coming weeks will allow time for the Office of Economic Analysis and the Governor's Council of Economic Advisors to analyze updated data and gather input. Both are needed before formalizing a new outlook, especially one that will likely represent a sea change relative to recent quarterly forecasts. In short, we believe that general fund tax receipts will drop significantly. So today, I am sounding the alarm. Our needs will far outweigh our resources, and until we have a better picture of the situation, we need to be extremely careful with state finances. The differences between a short recession and a deep depression is vast. We're seeing a gigantic ramp up in requests from every single sector of the economy. Happy to answer questions, or also happy to turn it over now to Alana Pertle-Guinea, who will talk more about the food and housing components. Thank you very much. I should also add, Mr. Co-Chairs, real briefly, the governor has requested Pat Allen at 11:30, so I would ask your indulgence, if possible, if he could go before the second panel in order to be able to meet the governor at that time.
What time is that?
11:30.
11:30. We'll try to accommodate that. Thank you. Are there general questions for Nick Glosser at this point? Representative Barretto.
Thank you, Mr. Chair. Hey, Nick, you mentioned May 20th. What on fiscal evaluation, I think, is that correct?
Next forecast.
That's the normal, yeah, Mr. Co-Chairs, Representative Barretto, that's the normal scheduled next revenue forecast date.
Okay, got it. Thank you.
Thank you, Nick. Appreciate you being here and kicking us off, and I think we'll just go ahead and go down the line and get these presentations out and get the information in front of us. I believe Alana Pertle-Guinea is next.
Hi there, Co-Chair Holvey, Co-Chair Roblin, thank you so much. For the record, my name is Ilana Pertle-Guinea here on behalf of the Governor's Office. I do want to pause for a moment and just thank all of your members there today and listening in who have been able to join our daily update calls. We are trying to get information out to you as rapidly as we can, and I know there are a number of questions that we haven't yet been able to answer, but we are working through those studiously and trying to keep up as more come in. We want to make sure that you all have everything you need to respond to your constituents. Our office is currently looking at a variety of options for relief and recovery. In fact, as Nick detailed, over a dozen agencies have already taken actions, but we know that there are areas where we'll need your help as well. There are many needs. Workers across industries are worried about their jobs. Some are already laid off. Small businesses, especially the micro businesses in our state, are unsure what the future holds for them. Independent contractors have even fewer supports, and we know there are people who fall through the cracks of all three of those groups. Folks are scared and they are struggling. As Nick laid out, there are some immediate concerns that we are focusing on. How do we keep people housed? How do we keep people fed? How do we address our business needs and economic preservation? And I would add to that, how do we keep our healthcare industry moving? I'm going to briefly talk about all four of these buckets, and then we have some experts in the room who can go into more detail on a few of them. First, how do we keep Oregonians housed? As we have talked to our agencies, our office's policy advisor, and stakeholders about housing, there are clearly two broad approaches that we could take in Oregon. One is rental assistance and potentially mortgage assistance as well, direct payments to individuals to make sure that they can stay in their houses. And the other is a moratorium on evictions, a move that has been taken in localities both in our state and other states. Additionally, these two approaches can work in conjunction with each other. And as we've had conversations within our office, we would encourage you to look at both of those paths, but also how they work together. Because we know that a moratorium on evictions alone, if you have low-wage workers who are not able to work through this crisis, can lead to evictions down the road when they're not able to make their back payments quickly enough. We know that rental assistance alone can leave a gap between the assistance available and the total rent payments, and having that moratorium on evictions can help make sure that folks have more time to close that gap. So we would strongly encourage you to look down both those paths and look at how they work together. How do we keep people fed? There are a number of programs in our state that already address the basic needs of Oregonians. We have a variety of self-sufficiency supports within our Department of Human Services. We have our unemployment insurance benefits, which can be expanded and extended. And then there are options for direct payments. All of these approaches interact with federal programs, and we would caution you as you look at ways that we can keep Oregonians fed to be careful that whatever we do in-state doesn't jeopardize our match from the federal government, and that it preserves our core programs, because we know we have Oregonians who need these supports now, but we have even more Oregonians who rely on these supports on an ongoing basis, and we want to make sure we don't do anything to jeopardize those core programs and funding for after the crisis. Additionally, there is federal legislation which we expect to see move later today or tomorrow, and another bill which is beginning to be discussed at the federal level, which will start to address some of these self-sufficiency supports. Christian will have more details on these. The work that you all do could complement or fill in gaps there, but we really don't know what it is that we'll need to be looking at in state until we see the exact details of those pieces of legislation. Business needs and economic preservation. Our economy, as Nick had detailed, has already been hit, and hard. This bucket is really about two things. How do we get needed assistance out the door now to support Oregonians and Oregon's businesses? And how do we create flexibility for our businesses through the storm? Much of that flexibility is already happening, but as I said previously, there are some areas where we'll need you all to act as well. And again, the feds are discussing supports and assistance, and we'll see what needs are left after they do their work. Leah and Christian will have details on what we're hearing from business and labor leaders in the state, and I know you have a panel of those folks to discuss some of these needs with you today as well. Finally, healthcare. There are three streams of work and of need that Pat will discuss more on healthcare, but just as a brief overview, these include our hospital system, where we're worried about capacity and supplies, our emergency medical system, where we're concerned about supplies and also about protecting our workers who are on the front line of this crisis, and then care for vulnerable populations, our congregant care settings, our shelters, etc. In these areas, how do we protect residents and workers who are in close proximity to each other on a 24/7 basis? We are working through all 4 of these buckets. We have Leah and Christian here to go over more details on the 3rd, economic preservation and business needs, which I know is a strong focus of this group. We will have Pat Allen talking about healthcare, and we are happy to get you more information about how we keep Oregonians housed and fed as your work moves forward. Finally, I just want to close by saying that we are ready to work through specifics with you all. We know this work is going to need to move fast and won't be easy, and we look forward to coordinating closely over the coming days and weeks. I'm happy to take any questions, or I can turn it over now to our folks who have some details for you.
Thank you, Alana. I think one thing that's going to be critical for us is really understanding where the resources from the federal government will be deployed and how we best supplement that money without duplication. So as you get communications from the feds on what exactly we're going to get and when, that's really helpful. I know they are, seems like, moving slowly, but there's a lot of emergency feelings about us taking action. So if we can identify things that we can do that aren't going to compromise any federal dollars or become messy with trying to administer 2 different things going in parallel paths. We want to try to stay away from that, as you referred to that. But having that knowledge is going to be really critical for us in the legislature, as you know.
Absolutely, Chair Holvey, and we will make sure to share that information with you and with your co-chair as quickly as we get it. I know Christian has some updates on dates that he'll be able to share with you. We got a little bit of additional information from our federal delegation this morning, and we'll be checking in with them again either this evening or tomorrow morning for some updates on timelines. So we will share with you whatever we can. Thank you.
Representative Evans.
Thank you, Co-Chair. So the question I have, and this may not be answerable today, but it will be critical for how we move forward, at least from my perspective. What is the timeline horizon you are thinking of based on the modeling? Are we thinking 1 wave, 2 waves, or 3 waves? Because that impacts whether we're looking at trying to transition our economy into a part-time economy for 6 months, or for a year, or for longer. We have to make sure our investments are aligned with not putting ourselves into a corner if it's going to be a longer timeline. So what is your plan, your team right now? What is the timeline horizon you are thinking of before, quote unquote, the health bubbles go through and we might get back to whatever we used to call normalcy?
Representative Evans, committee chairs, first of all, I want to thank you so much for that question, because I think that's a critical context as we look at how we provide supports for Oregonians. I would like to let our healthcare experts answer specifically on the timeline, though I think we are looking at the shorter end of what you've laid out from everything I understand from them. If folks aren't able to ask that today, I'll try to make sure we have somebody who can get that answer to you as quickly as possible. I will say that as we have taken efforts this week through the governor's executive orders to try to flatten the growth, or at least lower the curve of the growth so that we don't exceed our capacity within our healthcare systems, we know that that does extend out exposure a little bit. We're trying to make sure we don't extend out exposure in any significant way as we lower that curve. So we are very cognizant of the needs there, and I'll make sure that we can get an answer for you shortly on a specific timeline.
Chair Holvey, I have a question when there's a moment.
Senator Gelser has a question. Go ahead.
Thank you, Mr. Chair. Alana, in terms of the workforce, I'm hearing from constituents who are confused about instructions to stay home if they are workers, but their employers are not allowing them to work from home and requiring that they come in, which is forcing them to rely on informal childcare or grandparents for childcare. Is there anything that we can do to help employers understand the need to allow people to work from home so that they can comply with the instructions that we've given them, especially around children for non-essential workers?
In industries where the governor hasn't issued specific guidance yet, I know that there is a patchwork of approaches being taken by employers. The governor has made some pretty strong statements asking employers to do everything they can to either change their business model to be less interactive with individuals or to allow people to work from home. But we do know that there are some industries where neither of those are options. We are trying to work through that on a case-by-case basis where needed. But I think in general, the advice that has come out from the executive branch has been where folks are able to work from home, that should be the priority, and where they are not, social distancing measures should be in effect. I can make sure that we have more information on that coming out that you all can share, and we're also sharing information with local elected officials so that they can try to move messages in their communities as well.
And thank you, Alana. Just as a follow-up, would it be appropriate to say to constituents who are trying to deal with this by organizing informal group childcare where 10 kids go to somebody's house or large groups of kids go to a park to play, that is not appropriate? Can you confirm that we want people to keep their kids at home, not on play dates and sleepovers, and not in informal child caring arrangements?
Thank you, Chair Holby, Chair Roblin, Senator Gelser. I want to start in answering this question by saying I am not a public health expert. However, from the conversations I have had with our public health folks and the conversations I have had with the governor about her expectations, we know that there is a need for childcare, and that is why we have not issued any specific direction up to this point on closing childcares. We've in fact asked childcares to stay open, but to do everything they can to ensure that things are being cleaned as readily and rapidly as possible so that our families who do need to work, especially our healthcare providers, our EMS providers, our critical service providers, our grocery store workers are able to go to work. For parents who are able to stay home, keeping kids from having play dates is helpful. For parents who do have to work, keeping kids in as small and consistent groups as possible is helpful so that we are limiting the number of touch points and limiting the different number of touch points and doing everything we can to protect everybody.
Thank you. I just want to comment. There are a lot of questions, and I want to try to keep those questions about the governor's guidelines or the coronavirus guidelines that are out there maybe more towards when the health authority comes up, and I think they're going to come up at 12:30 is the new agenda. And so that will be Pat Allen coming up as far as the specific health guidelines. We want to try to focus on our first scope is how are we going to economically help the public get through this as being something really immediate and how we're going to fill in those gaps with the response on later on in the conversation. So I'd like to really move on and get the governor's presentation out as much as we can around these economic issues. Senator Bowles.
Thank you, Chair Holby. In light of the fact that we just had a child care conversation, and Alana and I have had several conversations, I just wanted to know if we could get a quick update of where we are with the plan around first responder child care.
Chair Holby, Chair Roblin, Senator Bowles. I can answer this quickly and then let you move on to some more of the economic recovery and relief presentation. The governor, in her guidance that included expanding the closure at our K-12 schools yesterday, released the first formal announcement about child care for our first responders. What we are doing is asking every school district, as part of continuing to receive their regular payments, to come up with a plan to offer child care for those families who are working in the healthcare and first responder fields. I can make sure to get you the guidance as soon as our Department of Education has it out. They're working on that today.
Thank you.
And
absolutely.
And I think that will definitely come up under our workforce conversations for sure. Not seeing any other questions for you, Alana. Thank you very much. Would like to move on to Leah Horner.
Thank you, co-chairs. Good morning, co-chairs and members of the committee. For the record, I am Leah Horner. I am the Jobs and Economy Policy Advisor and Regional Solutions Director in the Office of the Governor. As Chair Holvey mentioned, under the Governor's emergency declaration, we stood up the Governor's Coronavirus Economic Recovery Council, and they met for the first time yesterday. The council is made up of state agency directors, business, labor, local governments, and the co-chairs of this committee were able to join us yesterday as well. I believe the charter for the work, including the membership, is on OLIS, but if there are further questions on that, I'd be happy to take those. To Representative Evans' question, the council will be addressing immediate, short-term, and longer needs for both Oregonians and Oregon's businesses. The council will also be focusing on ongoing needs assessment, identifying gaps, and finding innovative solutions to bring forward for consideration to both the governor and to this committee. Over the past 4 days, I have heard from hundreds of small, medium, and large businesses, the arts community, manufacturers, and many others who have been impacted, who have been willing to share their stories, their angst, their struggles, and their love for being a part of the backbone of Oregon's economy. We'll be working on including more voices in the work of the council through standing up regional recovery teams through our regional solutions structure, and more information on that will be posted on our website and through our weekly exchange. That's kind of an overview of where we are with the council, but I'm going to pass it over to Christian to talk about more of the work that has happened to date.
Thank you all, Chair Holvey, Chair Roblin, members of the committee. For the record, my name is Christian Gaston. I'm the Governor's Workforce and Labor Policy Advisor. Leah and I are maintaining our social distancing here, but we are trying to provide information to you as a joint panel. So if there's a question better directed to her and her direct interaction with small businesses, we'll figure out how to do the do-si-do up here. Wanted to give you an update around kind of the work to date, because when we met with the Economic Advisory Council yesterday, I think the co-chairs heard this and echoed this. There was a broad consensus among both folks who represent workers and folks who represent business that we need to, one, prioritize public health, and two, make sure that we're doing everything that we can in an urgent way immediately to help workers and businesses through this crisis. I wanted to give you an update on the work that our state agencies are already moving on, and then a little bit of an update on how the federal government is responding to this crisis. To begin with, we recognize that there are many employees who are now unemployed, who are seeking unemployment benefits. Many of them probably for the very first time, or first time since the Great Recession. Navigating that process is always challenging. Right now, you may be hearing from folks who are saying that the website is not working for them. That is something that we're working through with our federal partners. There is a federal database that is being overloaded by all of the activity throughout the states right now. As we understand it, the website is working. Folks should continue to work through those things. Employment is working on issuing temporary rules this week, following up on guidance that the federal government gave states last week that will close some of the gaps in coverage. Before this crisis, somebody needed to actually be able to work in order to receive unemployment benefits. Obviously, if you're under quarantine or you're self-quarantined, you're not able to work. So we need to close that gap and make sure that people have access to unemployment benefits. The Employment Department also told the adjudicators that sort through these claims to hold off until those rules are in place. Also, at the Workers' Comp Division, we are working on guidance for healthcare workers and first responders who may be interacting with patients who have COVID, around how workers' comp can be layered into the benefit structure here. that this is a question of whether this is a industrial exposure. We're hoping to have guidance very soon on that front. The Department of Revenue has posted to their website guidance for taxpayers. That advice has been up since last Friday, outlining the process taxpayers can use under current law to seek extensions and relief if they are unable to pay at this time. The department went through not just the personal income tax, which obviously we're heading into personal income tax season, but also the other tax programs that they administer. We will continue to update that information as the federal government moves to change the rules. As you understand, as you all know, we connect to certain aspects of the federal tax system through our income tax code, and so some of those things come through automatically. Some of those things may need legislative changes. We are also standing up a process to identify rules that need to be suspended, either for the continuing operation of state business or for the continuing operation of private business. We're having we have an internal process to review those requests and prioritize them for action, either through executive order or agency actions. We are also working on a similar process to look at licensure more broadly. I think Nick mentioned the work that the DMV has done on that front. We're expecting that other licensing boards are going to have to follow suit, and we want to establish a policy framework for rationalizing that work. Additionally, we are expecting very soon to hear from the federal government about the Small Business Administration Loan Fund, which is a good transition into the federal work. So the first COVID-related bill that the legislature, that Congress passed, did a couple of things. It focused on getting resources to states to respond to the healthcare crisis, and it also capitalized Small Business Administration's Small Business Loan Fund. Once we get a federal declaration, hopefully this week, those resources will be available to small businesses who are hurting from the crisis. The second bill focuses on establishing new paid leave requirements for employers, and also extends family medical leave provisions. The bill that passed the House is now in the Senate. We're expecting that the Senate is going to deliberate on that bill this afternoon or this evening, and it's changing a couple of the key functions, including which businesses are subject to those rules. So I think we need to watch what comes out of the Senate, and if the House and Senate need to convene to finalize the bill before it goes to the President's desk, we'll get a better sense soon, basically, about what the changes at the federal level are going to be. That's important because we have been working with our state workforce and with also other public employers and private employers across the state in trying to establish basically a flexible leave framework. So at the state level, we have signed letters of agreement with our major bargaining units, AFSCME and SEIU, that lays out how employees who can telework, should telework, how employees who are sick can access sick leave, paid administrative leave, access sick banks, and borrowed leave. We are also hoping that other employers establish those frameworks, because it'll provide employees who are working in essential services some guidance, to Senator Gelser's point earlier. The third piece that the Congress is working on, I think you've probably seen the President talk about this, is a large stimulus package. I think we're hearing that something on the order of it's nearing $1 trillion, maybe 1.2 is what's on the table right now. That is going to be critical because, as Nick outlined, our income tax, and Senator Roblin also outlined, our state resources decline in a recession at the same time that demand for our essential services increases. And so this federal aid is coming at a very critical moment for the state and a critical moment for the economy. You're going to hear, I think, today from a panel of folks who are engaged in our Economic Advisory Council, and you're probably going to hear the same thing that we heard yesterday, that cash now to help business cash flow and employee cash flow is the critical need. And we're very heartened by the actions that Congress is taking today to get that deployed. With that, I I think I'll take a breath and see if there are questions that we can address, either Leah or I. Happy to answer anything.
Representative Holby? Representative Holby? This is
Yes.
Kathleen Taylor.
Kathleen Taylor, go ahead.
Thank you, Chair Roland. Mr. Gaston, I have a question regarding how, when one files for unemployment, it's my understanding that if you are an individual that works in the service industry, therefore heavily reliant upon tips, gratuity of any type, it's my understanding that is not factored into your payment. And I'm sure many of us are hearing from constituents who not only do they work in the service industry and their understanding maybe get unemployment, however, it's not at the same level because of the not being able to factor in tips. Maybe I don't understand the law, so I was wondering if you could clarify whether or not tips are any part of the calculation, and if not, can there be anything done or requests made to factor some of that in, some sort of percentage or something, please?
Chairs Holvey and Roblin, Senator Taylor, your understanding of the law is correct. That is a historic gap in the federal unemployment insurance system. I will follow up with the Employment Department to see if there's administrative flexibility around that. That's not a conversation that we've specifically had to date, but I think it's a good one to start.
It's a question.
Thank you. And then can you just, I know you're doing a great job. I'm just trying to understand a little bit more about the timeline for when at least you think that folks can start to anticipate some sort of payment, because obviously all sorts of people, even if they maybe were not officially laid off, no one was going to their establishments, right? So they already were behind on receiving an income, see what I mean, for the last few weeks. And so now waiting for the first unemployment check to come in, how quickly can we start to, just so we can manage people's expectations, not meant as a criticism, more of just wanting to be able to get the information out to constituents, please?
Co-chairs Roblin and Holvey, Senator Taylor, that's a fantastic question. I think I want to back up for a quick second and put this a little bit in context, because you're asking you're asking questions in the right frame. I think there are kind of three general buckets of employment that we're hearing from folks on. One is a kind of a job where it's like maybe you're working for a tech company or in professional services, and you're teleworking and your paycheck is still coming in, and your business operation is so far still running, but maybe at a different level. There's another bucket of workers who are engaged in things that really you can't telework from, right? But they're essential services, and demand still exists in the economy for those services. Some of our food processing, manufacturing firms fit in that category, and certainly a lot of state workers do. And then the third is that service worker economy, that economy that responds really quickly to consumer demand, and that's leisure, hospitality, and some levels of retail. And those are the folks, whether they're employed, independent contractors, small business owners with just a couple of employees or maybe no employees at all, they're all seeing demand drop pretty substantially. We've got data out of Open Table that has shown a 50%, maybe 60% now cut in consumer demand for restaurant services. That was before the recent social distancing rules went into effect. So that is the bucket of workers that are really looking at the next rent payment and wondering how they're going to get there, right? So the question about how quickly we can get dollars out to those folks is a really important one. For the unemployment system, that is operating as is right now, and folks should be filing. We'll have a better sense of how many filers we got last week on Thursday, and certainly we're seeing a big flood right now. For any new federal benefits, that's a really important question. I think we don't quite know the answer to that yet. We've seen a couple of different iterations of what the federal benefit could look like. It could look like a $1,000 payment to every family. It could look like a change to the payroll withholding mechanism. Each of these has kind of pluses and minuses, right? The federal government standing up a new program to deliver resources might be a little slower than tax relief, but if you're already disengaged from the economy, as you've highlighted, Senator Taylor, tax relief is not going to get into your pocket. So I think those are things we need to keep telling Congress, and we will take that feedback directly to our federal delegation. We're engaged with them right now in what that financial aid package should look like.
Okay, and then one last question, if you don't mind, Representative Colby.
Yeah, go ahead, follow up.
Believe it or not, I also have constituents asking about where they can work. They want to be able to work because they're very concerned, and we already have felt the drying up of their resources, correct? And so I happen to see in the paper Amazon's hiring 100,000 people, things like that. I think that I have not done it myself, but I understand if you go onto the employment website, I'm not sure what's there or not there. Are we allowing people or encouraging people to do some other type of a job that could be useful? For example, having college students do childcare since they're not in school anymore, having high school students do some things that we couldn't do, some of the lower risk populations doing some of the jobs that may need to get done, or are we simply saying we don't want people seeking new employment right now, which is understandable? I'm just curious about what the state's response is to that, please.
It's a mix. So for childcare, we absolutely have formed a team to prioritize childcare for first responders and essential services in the healthcare industry, and we are looking at finding unattached, disengaged employees who can fill those needs. I think the second question is a good one. Our existing workforce system is in place to do rapid response through the WARN notice system, and we're encouraging employers who are laying folks off to use that system, because that's how we can move workers from one firm that's shutting down to another firm that has demand. But I do think that we all have to keep in mind that the public health information is changing very rapidly on the West Coast. We're hearing from Washington State kind of how this is playing out on a daily basis. They're, as far as contact, they're about a week ahead of the state of Oregon, and their curve remains ahead of ours. You'll hear from OHA. And so I don't know exactly if we have clarity that a massive worker relocation program would make sense at this moment, if that makes sense in that context, Senator Taylor.
Okay, thank you.
Thank you. I think it's just worth noting that Oregon's unemployment system is tied to many of the regulations and restrictions of the federal system, and so we don't have complete autonomy in reshaping our unemployment system without the federal government being involved in that. Senator Bowles, question?
Yes, thank you, Chair Holvey. Back on the SBA lending list, I just like to know for the record, I know there's been a few counties that are on that list right now, and you had alluded to it. When can we expect the rest of the counties in the state to be able to have access to that those funds? When was the...
Leah's going to join us for that question.
Thanks, Leah.
Chair Holvey, Chair Roblin, Senator Bowles, this is Leah Horner. The SBA modified their requirements for a statewide declaration yesterday at about noon, and so we submitted an updated request to the SBA for that declaration at about 5:30 last night, and should expect to hear back either today or tomorrow.
Thank you.
Thank you. Next, Representative Salinas.
Thank you, Mr. Chair. Mr. Gaston, you mentioned that you'll be trying to layer in healthcare workers and first responders into our workers' comp system for those who are affected by the virus and aren't able to work. Will there be other essential worker categories, such as daycare providers and others who are supporting those frontline workers?
Chairs Roblin and Holvey, Representative Salinas, it's a fantastic question. One thing to keep in mind is that Washington State was able to move very quickly around these determinations because they have essentially a single payer system for workers' compensation. We don't have that system. We have as you all know, SAFE insures many workers, but we also have self-insured employers in the marketplace. And so what the Workers' Comp Division has been doing has been engaging in those self-insured employers with this question: how would their policy be shaped, and how can we get the market to move into a sort of presumption that if you're on the front line and you're exposed at work, that this is an industrial exposure. The conversations to date have been focused on first responders and healthcare, but I'll take that guidance back, that we should dig a little bit deeper and ensure that we're looking at all essential services that are going to be required to be maintained during the course of the outbreak. That's great feedback. Thank you.
Thank you.
Senator Steiner Hayward.
Thank you, Mr. Chair. Two quick questions. I didn't quite catch, Mr. Gaston, when you were talking about taxes. I know the IRS at the federal level is waiving interest and penalties during this extension period. Is the Oregon Department of Revenue doing the same?
Chairs Holby and Roblin, Senator Hayward, I want to follow up with you directly. I will send you the guidance that the Department of Revenue posted on Friday, and I'll give you a little bit of an update as the federal changes are going into effect. I alluded to the fact that we don't automatically connect to every provision of the federal tax code, and so I don't have clarity today about what changes are going to automatically be reflected and what changes aren't. I have a meeting with the department this afternoon to get an update on that.
Thank you. Perhaps to be kind enough to send it to Ms. Norland and the chair so that they can send it to everybody on the committee and post it. And the second issue is this, and it's sort of a follow-up to Senator Taylor's question. I was having a conversation with a colleague of mine who's a Beaverton City Councilor and has a lot of experience setting up emergency medical facilities through the Army. And she was pointing out that the Army, in times of crisis, retrains people to do very basic frontline assessment, health assessments. And she had spoken to Commissioner Hoyle, who said that she thought, but was looking into, that the Bureau of Labor and Industry had the capacity to issue certificates and waivers and set up this kind of stuff. Are we talking about that? Because we are likely going to need people to do really basic triage, and we want everyone working up to the level of their license in the healthcare system right now.
Absolutely. The Oregon Health Authority can probably give you a little bit more detail around that, but they are in the stages. They've had ongoing conversations around healthcare workforce, and there's been some work at the nursing board, for example, and with the OMA around this question. They're forming a task force right now. I think everybody's getting seated today to address those questions moving forward and to better coordinate care. I'll also add that the military department is engaged in our operations center for emergency management purposes.
Thank you.
And before I go to Senator Knope online, I just wanted to follow up with some of the conversation about the federal government and our federal agencies that are working within the state of Oregon. Do we know, or can we encourage our federal partners to encourage them to also work from home? Because I don't think the state of Oregon has any authority over their work scenarios. If they're non-essential, it seems like they should be doing the same thing. I don't know if you've had any conversations about that, but that seems like it would be something that would be beneficial.
Chairs Holby, Roblin, that's a really great suggestion. We'll start that conversation. I'm not aware of us having that just yet, but that's a great one.
Yeah, and one of the other ones about the licensing, I know there's several sectors around licensing that do have a lot of concern about providing some flexibility for licensing, as there's some that are on time frames that probably can't be met now. And so I know that your group, somebody within your group, is going to be looking at potential statutory changes around some temporary license flexibility, as well as perhaps regulatory flexibility as well, in several different sectors that will be impacted, trying to keep some of them up and running through this crisis. I think we're really anxious to see some recommendations around that. And you don't have to comment about that quite yet unless you have something on, you want to say to that. I don't know if there's been a lot of discussions about what regulatory flexibility we can provide and whether that's going to involve statutory changes or that can be done by rule. It probably depends on the license and agency involved, I imagine.
You're absolutely right. I totally agree with you.
Representative Holby, may I make a request of Mr. Gaston in the governor's office, please?
Yes, go ahead. It's hard to manage. I got a lot of people in the queue, but go ahead. You're right in front of Senator Knopp.
Oh, wait, you're in front of Senator. No. I'm sorry. I can't tell who's in the queue. I really apologize. I will wait. I just had a request of Mr. Gaston in the governor's office. It wasn't a question. It was just a request, but I will wait for you to call on me. I apologize.
No, go ahead while you're talking.
Okay. So, co-chairs and Mr. Gaston, for those of us who serve on the Revenue Committee, we went through, I'll try to say this in the most respectful way possible to our sitting president, that we went through the challenges of implementing the 2017 Trump tax plan. And I just wanted to make a request to see if our governor and our delegation is pushing to make changes in that tax plan that President Trump often referred to as the Trump tax plan in 2017. There are several provisions in there that benefit some of the very, very, very top wealthiest people in the country, and that there could be some additional resources available if some changes were made within the Trump tax plan. I'm sure folks are aware of that, but since you said you were having a meeting with the Department of Revenue this afternoon, I just wanted to make certain or ask if that could please be taken into consideration for that request to happen from our governor and from our state, please.
Chairs Holby, Roblin, I'll take that request to the department. We'll include an update around that question with the broader revenue update to the committee.
And that's a great segue for Senator Knopp.
Oh, thank you, Chair Holby. Obviously, besides keeping our constituents safe from the virus, the most important thing besides that is making sure that they have money in their hands to pay their bills, their food, their rent, and what have you. And because of the order that was given to essentially close restaurants, we have roughly 8,000 people in that industry here in the Bend area, and many hundreds of them were essentially let go yesterday, and I'm sure there will be a cascading effect. So my question really is to, in regards to unemployment, there seemed to be capacity issues yesterday, and I just wanted to see what the capacity is going to be going forward, because it seems like that's going to ramp up substantially in the very near future as more of them try to file for unemployment.
Yeah, Chairs Holby and Roblin, Senator Knopp, it's great question. I'll give you an update on that front. The capacity, the sort of pinch point in the system right now is a federal database that matches Social Security numbers. And as people go through the application process online, there's a point where our system needs to get that federal database to verify the Social Security number. And if that federal database is overloaded and not responding, it'll affect the session that the Oregonian has begun online with the Employment Department. And so we've been in contact with the federal government around flagging this issue for them. They know that it's an issue. Our state CIO is getting daily updates, probably hourly updates. Frankly, I'm getting daily updates on the progress there. And we don't know how many states are affected, but we know that it's not just Oregon that is affected by this federal pinch point. On
And just,
capacity for the department.
Go ahead.
I might have been anticipating where you're going. On capacity for the department, at this moment, the department has both implemented telework policies and is working through their continuity of operations plan, and they do feel like they have the resources that they need at the moment to respond to this surge in applications. If that changes, I'll certainly let you all know.
And just to follow up to that, you may have mentioned this briefly, but as it relates to, I think there's a 1 week waiting period currently to get benefits. Is that still accurate? And if so, what is the process for waiving that week to keep money in people's hands?
Unfortunately, this one also goes to computer software. As you know, our employment department is engaged right now in modernizing its computer system, but until we do, we are reliant on a number of computer systems written in the COBOL language, which I learned Turbo Pascal in school, not quite old enough to have learned COBOL. So the challenge that we face in trying to close that waiting week period is restructuring that COBOL IT structure. It's not something we could do in an emergency short order, and it's important for folks to remember that the waiting week period also doesn't change the total benefit allocated to the employee during their unemployment.
Thank you.
Representative Moore Green.
Thank you, Chair, co-chairs. Mr. Gaston, I suspect I know the answer to this question, but I will ask. Unemployment is currently paid every 2 weeks. Is there any changing that to once a week?
We have not had that conversation, but I'll certainly ask the department what their recommendation would be on that front.
Thank you.
Senator Steiner Hayward.
Thank you, Mr. Chair. Senator Johnson reached out to me, and she was participating in the community town hall, and somebody made the suggestion that we could offer additional stipends to frontline healthcare workers who have to work, and we need them to get childcare from trusted friends and family. We were talking earlier in this committee about the need to create smaller groups of childcare, and I think it's a really good idea because their regular childcare providers may not be available, and yet they may still have to pay them to hold their spots. So I just think we need to be thinking about not only how do we make sure that our frontline workers have workman's comp or whatever related to this, but also have the resources they need to get the childcare they need so that they can keep working.
Co-chairs Holvey and Roblin, Senator Steiner Hayward, that is a great suggestion. I'm proud to say that somebody on our team thought of that as well. We've got, we'll get an update on the child care front for you all. They have been working through those issues.
Thank you.
Thank you. Mr. Gaston, also, while we're on the worker comp conversation, has there been discussion about the potential for waiving premiums for a certain period of time as a cost-saving element for business?
Co-chairs Holvey and Roblin, I think every agency that is on that withholding form is thinking about those questions. Can there be some flexibility offered? What does that do to the bottom line? What does that do to cash flow? I think we do just, around all of these questions, have to have that balanced conversation at the same time as we want to provide flexibility and for workers and employers and ease the cost of this economic interruption. We also have to maintain these critical services, whether it's getting those unemployment benefits out or the workers' comp benefits out, or providing child care, corrections, public safety. So we're having those conversations, but we're weighing both sides of the sort of balancing act there.
And just another question from me. I would just on these worker benefit programs, i.e. unemployment insurance, workers' comp, paid sick leave, those elements seem like they're potential for helping workers that are employees. There's been a lot of concern around independent contractors because they don't pay into those safety net programs. And in light of that, how do we see independent contractors? Are they going to fall in the same bracket with small business as such because they actually, as independent contractors, are operating as small business? Are we going to be able to address that category of business or workforce in that bucket, as I see the federal government, as you mentioned, has a proposed substantial amount of money in that particular bucket?
Co-Chairs Holvey and Roblin, members of the committee, this is a great point. It's a historic gap in our safety net, as I know you know, Chair Holvey. I do want to offer to the committee that a member of a limited liability company or corporation who is paying themselves and as an employee, so long as, to the co-chair's point, that employee is withholding UI insurance coverage payments on that paycheck and workers' comp, they are able to seek relief. If they're just a member of an LLC who's being compensated through distributions from the LLC, but not as an employee, then they do fall into that independent contractor sort of loophole, as I understand it. I do think that that's a really critical conversation to be having with our federal delegation. It's one that we will be pressing with we know that Oregon's economy relies on small business people, entrepreneurs, folks in the gig economy, and we can't leave them behind.
Thank you. Senator Roblin.
Yeah, I just got a text from one of our other senators asking if we do start to have a capacity issue in our UI processing, is it possible to switch to a swing shift opportunity to get more eyes on the stuff over a period of time?
We, in our conversations with organized labor and our workforce, I think everybody understands that this is co-chairs Roblin, Holvey, members of the committee, I think everybody recognizes that this is a rapidly changing environment. And if we reach a critical break point like that the governor has the authority under the Constitution and the powers granted by the legislature to suspend rules and regulations to make those vital systems work. We'll take whatever steps are necessary to keep folks getting those benefits.
Chair Holvey, this is Senator Finley. Can I get in the queue?
You're in it. Go ahead.
Thank you. Thank you. I appreciate the comments, and there's a couple of sectors that gave us great concern, and that's the owner-operators of small businesses, whether it be truck drivers or daycares or others, that it sounds like they very well could fall through a safety net or fall through the cracks. And I appreciate the comments that we're looking at them, but I don't think we should be relying on our federal partners to do that. I think that's something we should do. And the most recent comment about perhaps looking at the ability to suspend rules and some of the collections, the impacts of this as we're nearing the end of this month as the first quarter of the year, the estimated tax payments for both the CAP and other payments, whatever thing we can do to give immediate relief to these owners, operators, and businesses, I think we ought to look at. I think there's some critical things coming up within the next 10 days that if we can give them some relief, we should. I would encourage us to look into that as quickly as possible.
Co-chairs, I'll take that advice. Thank you.
Senator Steiner Hayward.
Thank you. I think a lot of these questions point out one of the biggest challenges we're facing in this crisis, which is that to keep our small businesses in particular going and to protect the larger businesses that have made substantial investments in our economy. When you have an organization like McMinimans lay off 3,000 people overnight, which is across the state, that tells you something about what's happening here. But to keep businesses going, we can and should be taking steps like the ones that have been suggested by people on this committee and others in terms of tax relief and things like that. And yet, at a time like this, the state has the largest need for revenue to be able to help people who are really in crisis, especially through unemployment or a need for additional child care or food subsidies. And so we have this huge countercyclical problem. I think one of the differences, to my mind, between this situation and, for example, the Great Recession of 2008 is that it is probably time limited and we know what's causing it. While it's true that the market was probably due for a fairly substantial correction, this is obviously way more. And if we can bounce through this, what we need to do is keep businesses going, especially our smallest businesses, because if they go out of business now, they're not coming back for years. And so the little things that we can do now to at least help them cover their basic overhead is going to be critically important for the recovery of our economy. Small businesses generate such a substantial percentage of jobs in our community. So I just want to put those thoughts out there so that we can think about how different this situation is, for example, what we dealt with in the 2008 Great Recession.
Yeah, those are
Co-chairs, Holby, Roba, I can speak to that, to the senator's concerns, maybe real briefly, and probably help with the conversation here. You know, we don't know yet whether this will be a short and deep economic downturn, or if it will trigger a change to global demand that will lead to further damage to the global economy. Our economists are going to know more in the coming weeks, as Nick Blosser mentioned, as we get better data. We'll know more as China cycles some of their economic activity back online. They're engaged in that right now, even though they still have new cases of the virus. But I think what our office is looking at is being very clear-eyed about what we do know and what we don't know, and being cautious about broad steps into the economic space without a full understanding of the data on the ground. So we'll have more to share very soon as our economists get better data.
Thank you.
Representative Evans.
Thank you. So appreciate this. I want to piggyback a little bit on what Senator Hayward said and put it to a larger scope. I absolutely agree that we need to help the small businesses get through this process and think of trying to retract to a part-time economy versus a full-time economy just to get us through. Mm-hmm. In the meantime, while we're doing that, the large companies in the supply chains are also critical to at least keep it a part-time. And the reason I emphasize that is one of the lessons that I think the state of Oregon learned the hard way after the Great Recession was once a business comes to a complete stop, even if they can start back up again, it's a large muscle movement of 2 or 3 months to get back up. And at the same time, we have a need for home housing and other products that maybe, if we find a way to do it, can be built with smaller groups, so we're not putting workers in harm, but still making some progress toward other goals and in a similar but smaller fashion, like the Works Progress Administration, leverage public funds for things we know we need anyway to try to basically keep enough people going so that when the economy does have an uptick, they can actually recover faster. I don't know how to put that in, but as the economic team's putting together policies, hopefully you can consider that.
Co-chairs Holby and Roblin, Representative Evans, it's a great point. It's one that we are absolutely taking in mind as we're looking at the critical supply chains and essential services that need to be online to make sure that to the extent that we can, we still have cash flowing in the economy, demand at levels that keep the lights on, to your point, perhaps in a part-time capacity. And it's certainly flexibility all around for manufacturers and, sort of where it makes sense to move resources from one strategy to another strategy those are the conversations that we're having right now. And I think the Economic Advisory Council is going to be a good place to sort through some of those things.
Yes, I appreciate your answering all these questions, and a lot of these are food for thought for your team to consider, and I know you've probably already considered a lot of those. There's just two last little areas I just wanted to highlight. I've talked to a few people who have great concern about not being able to keep their health plans intact. And that is also concerning if people are at home doing the right thing, trying to avoid catching or spreading this disease, and they lose their health care because their premiums are not being paid. And I'm hoping that there's some thought going into that to how we can do our best to make sure people stay on their health plans. And I've also probably we'll need some later input from you about whether this coronavirus is going as a pandemic is actually covered under health plans to start with. That's also a question that's been asked of me, and I don't know that anybody knows quite the answer to that across the board, but there are concerns around the viability of health plans through this process. And lastly, I know there's been a lot of concern about the personal protection equipment for our first responders, the healthcare providers, our grocery industry, and I know that's been a challenge for months, it seems now, to find that or to procure those items. And I don't know exactly where we're at with that, and I'm sure you're working on that from the federal government, but they've also made some recent changes around providing the equipment we need, whether it's ventilators or masks or suits or whatever. I just have a great deal of concern with our workforce in that arena because we can't afford to lose them to the virus, because we need more of them at this point, not fewer. So I know that's probably one of your top priorities, but I thought it was worth mentioning here.
Mr. Chair, I'm so sorry, but I keep getting, like many of us, I'm getting texts from people saying, what about this, what about that? The latest one is from somebody who said, well, what about the $1.7 billion kicker that's scheduled to go out as tax credits or tax refunds? But if people aren't filing and we're letting people delay their filing, they're not going to get those. And a few years ago, we made the change from doing those as checks to individuals to doing them as tax credits. We may want to think about how we want to manage that rather large sum of money. I'd make a pretty strong argument, again, hearkening back to Senator Taylor, that some of our much higher income individuals probably don't need those very large checks, and we ought to be thinking, but some of our lower income families could really benefit from this money sooner rather than later. So, Mr. Gaston, I'm sure you guys are considering this, but I just want to put it on your radar as another very large chunk of money that's out there that could be used to stimulate the economy and protect lower income families.
Co-chairs Holvey and Roble, I'd like to speak to all three of those points. So, Chair Holvey, early on in the crisis, we reached an agreement with the major insurance carriers in the state to ensure that testing for the virus was covered without cost sharing and copay. That's now become federal policy, but we were there first. In the first bill that, in Coronavirus Bill 2. There are provisions about health coverage and ensuring that health insurance continues to cover the virus. If there are gaps, we will identify those for you. To date, we are tracking that. The question about whether or not private insurance continues to be covered for folks who are unemployed and unable to pay their premium is a fantastic question. Those payments are going to become due as we move through the timeline here, so we'll keep track of that. To the kicker, Senator Steiner Hayward, the department is mostly up to date now on processing returns. As anybody from the Revenue Committee knows, that most folks file online or through an intermediary now through the Department of Revenue. So there's challenges in sort of cycling through these returns, but we are up to date as of this moment. I think the policy question about what to do with those funds is certainly one for this committee to have.
Yeah, thank you. I think that's a good point. We're in the middle of filing season now, so many people have already been credited with that kicker, I believe. So thank you very much. We need to move on to our next panel. Senator Roblin's got the last question.
I just wanted to say, along the lines of Representative Holvey's question, adding a couple things to your list of things to work on. The one that came up in that economic conversations yesterday was rental assistance of one kind or another, and Portland has already taken some action. Are we watching that closely to see how that affects not only the renter, but the person who owns the facility, who may have payments that have to be made too? So I just want to make sure that as we look at these things, we are considering the entire, when we make an action, what's the ramifications for that action on the back end? So hopefully we're watching that as it plays forward.
Co-chairs Holvey and Roblin, yes, this is a great opportunity for me to mention a couple other things I didn't mention in our opening comments. Through the Department of Financial Regulation and through the Oregon Housing and Community Services Department, we are looking at that entire chain, right? So not just the renter, commercial or residential, it's also the landlord, it's also the bank with the mortgage, and we're looking at all of those players to figure out where we have the ability to pull people together and solve some of these issues. We're taking a holistic view on that.
Well, thank you very much. I want to thank the governor's office and the presenters here today. Really helpful. I know a lot of people in our state government are working extremely diligently and hard, round the clock, to try to get out in front of this as best we can at this point. So I really appreciate the hard work and look forward to the collaboration and recommendations to help us help the state of Oregon and help you help the state of Oregon as well. So thank you very much. We're going to move on to our next panel, and I'm going to have Graham Trainer and Melissa Unger start us off if they're ready to go.
Mr. Chair, can you hear me?
Yes, we can.
Okay. Pull up the PowerPoint.
PowerPoints seems to be working.
Wow.
Thank you to our
Okay, can you still hear me?
IT staff.
Yep.
Great. Okay. Co-chairs Roblin and Holvey, members of the Joint Committee, thank you for the opportunity to share a vitally important perspective on the current public health crisis we are collectively facing, the perspective of Oregon working families. My name is Graham Trainer, and I'm proud to serve as the president of the Oregon AFL-CIO, the statewide federation of labor unions representing over 300,000 working Oregonians in every sector of Oregon's diverse economy. This is clearly a very challenging time for all Oregonians, and we appreciate the legislature's commitment to addressing the needs of our state through this committee's work. We also appreciate the governor's effort to bring stakeholders together through her economic advisory committee you just heard about, and the good, important work being done as we speak within a number of state agencies to address the needs and the immediate needs of Oregonians. Despite the challenges this crisis is presenting, one positive impact we've seen is the sense of common purpose that is bringing together diverse groups of stakeholders, labor, business, community organizations, housing advocates, advocates fighting food insecurity, elected leaders, and concerned Oregonians. Additionally, I'd encourage you to look at the testimony from worker and community advocates submitted to OLIS today. There have been so many organizations that have put in an incredible amount of work into ensuring you have important recommendations on how best to support impacted communities across the state. We must collectively act with boldness and compassion in these uncertain times. In addition to protecting workers and communities, this also means rejecting the xenophobia and racism we've seen as this crisis has taken hold. We've already had our sleeves rolled up in our efforts to protect Oregon working people and their families, and we look forward to keeping those sleeves rolled up alongside this committee, legislative leadership, the governor's office, state agencies, and local governments for as long as it takes. We also appreciate the opportunity to help ground all of us with the perspective of diverse types of Oregon workers and how this pandemic is impacting their lives. Melissa and I, as you introduced, will be presenting from the same slideshow. We're actually in the same room, but more than 6 feet apart, and we'll be happy to answer any questions after we complete our presentation. As you reflect on the worker stories and policy recommendations we'll be going over this morning, we must keep in mind the importance of ensuring that all our communities have access to these necessary programs and supports. This crisis brings to light some of the cracks and the gaps in our safety net, but it is important to remember that those cracks are most severe and lasting for workers of color, immigrant workers, and other vulnerable communities. And we must not make policy changes that will erode protections for low-income workers or our critical safety net. So with that, I'm going to start with the slideshow if it cooperates. Okay. So do you see the how do workers feel slide? You should. We've centered our thoughts on which types of workers are being most impacted by COVID-19. To organize our approach and to help us all think about this daunting task, we've segmented workers into 4 basic categories to develop a policy recommendation. Workers without telecommuting options, like construction workers, service workers, workers maintaining critical infrastructure, workers who are most needed to continue to report to work and most likely to be quarantined, like essential employees like caregivers, senior care providers, first responders, healthcare providers, nurses, hospital workers, civil service and utilities employees, grocery store and pharmacy employees. Another category of workers, those are folks that are economically vulnerable to disruptions in seasonal, temporary, or contracted work, and frankly, that could apply to most of Oregon's workforce. And of course, parents without access to childcare. And many of these worker categories, of course, can apply to the same individuals.
Mr. Trainer.
Now, we wanted to talk
Mr. Trainer.
Yeah, go ahead.
If you're expecting that your slide presentation is advancing, it is not, so you might try it again.
Or our IT people have to be doing it.
So it shows on my...
I believe we have it on OLIS too, so people can follow along on our committee site.
I think I'm sharing. Let me stop sharing. And then I'm going to share again. And then
that helped.
How's that?
Yep.
That worked.
Okay. Apologize for that. I thought I'd shared the right screen. Yeah, it's not. Oh, it does. Okay. Okay. Okay, so we're going to tag team trying to get this fixed. Apologies for the view challenges. So I'm going to move on and talk about some of the realities for working people today, and frankly prior to the crisis. Based on income, workers' ability to telecommute really varies. So we want to talk through the dynamics in the economy before the crisis, and it can really help highlight how the impacts of the crisis is falling on low-income workers and communities of color hardest. And as this slide suggests, that clearly higher-income workers have more flexibility on the job and more ability to telecommute, and low-wage workers disproportionately have much less flexibility. Again, this could change and probably is changing through this crisis, but the income trends do stay the same because of many workers' lack of flexibility on the job. While we have a strong Medicaid system, and thank God we do, we have many people who are very scared about out-of-pocket costs for health care and undocumented immigrants are likely to have no health care. And so this slide shows that low-wage workers pay significantly more and a higher share of their income for health care access. Most workers in Oregon do have access to paid sick leave that maxes out at 40 hours, but that is not enough. These trends in this graph hold true in Oregon. Communities of color and low-income workers are more likely to have the bare minimum of leave, while other workers may have access to more. This is particularly problematic in hospital and long-term care settings, since many workers don't have the ability to stay home. This graph shows what we all likely can assume and know, but lower income workers are less likely to have access to paid sick leave or paid leave in general. And this impact on the immigrant slide is important, and it highlights several points. I'd specifically like to point out the national statistics about what industries are most reliant on undocumented workers, with agriculture, construction, and leisure hospitality at the top of that list. And this slide shows, I think, an important point that union workers have it better, but it's still really tough for all low-income workers. And in collective bargaining battles and fights, the labor movement prioritizes fighting for access to quality, affordable health care and paid sick leave. And this crisis really shows why that's so important. Now, all workers are scared and fearful about their economic situation. While we won't have time to share all the different types of workers that are being impacted, and there are many more we'd of course like to include, we did want to lift up the voices of various types of workers from diverse sectors of Oregon's economy. And I want to start with grocery and retail workers. According to 2019 BLS data, 47% of grocery workers are women and 32% of them are Latino. In many respects, these workers are also on the front lines of this public health crisis, because when large swaths of Oregon's economy are impacted or shut down outright, these workers still have to go to work and serve our community. A scary story actually just came in just 2 days ago, where a grocery worker with a compromised immune system requested to wear a mask as a retail clerk and checker in a local grocery store, and they were denied and weren't allowed to do so. So we must, as a state, think about these workers as frontline and essential workers at this critical time, and think about ways that we support and protect them as our communities disproportionately rely on the services they provide. Next, I'd like to highlight service and hospitality work. We've been hearing reports of hotel occupancy rates at dramatically low rates, and of course the recent restaurant closures have led to major worker disruption. Event cancellations and travel restrictions continue to decimate this industry, and by extension, its workers. In addition to this industry, we've also heard major reports of arts and entertainment workers that are facing unilateral layoffs as events and performances have canceled. And one story I'd like to lift up and share is of a worker at the Portland Hilton. She's been a room service server there for over 10 years. And when she went into work last month, she found out that she was laid off. Now, since then, she's broken a tooth and now doesn't believe that she will be able to get it fixed before she loses her health insurance that she receives because of her union. Next, I'd like to talk briefly about construction work. While we haven't seen yet mass shutdowns of construction sites in large numbers, we must keep in mind the reality for workers in the construction industry. Telework is clearly not an option. Given the nature of the industry, if you don't go to work, you don't get paid. The work is intermittent and jobs vary greatly in their duration. And in the midst of this crisis, we've heard reports that some contractors have been unilaterally enacting zero-tolerance sick policies in response and sending people home based on their own discretion. And while there's some possibility of adequate social distancing on a construction work site, there are inherently other situations that require high volumes of workers that find themselves working and interacting in much more close proximity. And additionally, it's not clear what effective and consistent measures are being taken on job sites to ensure workers have appropriate and adequate safety equipment. And frankly, these workers have always relied on access to unemployment insurance benefits when they're out of work. And so we must ensure that these workers are considered and prioritized for if and when there are major disruptions in the construction industry. Next, I wanted to talk briefly about school employees and educators, including substitutes. While school closures have been an important step to slowing the spread of COVID-19 and reducing exposure, we can't forget that the very first known case in Oregon was of an hourly worker in a Portland area school district. Janitors, nutrition service workers, and cafeteria workers, substitute teachers, these are all folks that are part of our public education system, and many of them are hourly workers. While janitors and nutrition services workers have some protections during our public school closure, substitute teachers are completely out of luck. And low-wage hourly school employees that are laid off do not have the same protections and safety net that others in the school system do. Touch on firefighters and first responders. Firefighters in Oregon continue to take the call and respond to this unprecedented pandemic each day. Unfortunately, that exposure has led to a total of 19 first responders in quarantine as of just a few days ago, and that number may have changed. Additionally, we're hearing reports of some equipment shortages and unfortunately some price gouging to our local fire departments, even after the governor's order. First responders will continue to be a critical part of our state's response to this crisis, just as they always are. But the unknown exposure and risk associated in the midst of the COVID pandemic requires us to be mindful about the long-term impact on these frontline workers, as well as how to properly ensure their access to workers' compensation and other worker benefits in the event that they contract the virus. I'm going to now turn it over to Melissa Unger, who will take the slideshow from here. Thank you.
Thank you, committee. Co-chairs, my name is Melissa Unger, and I'm the Executive Director of SEIU Local 503, and I'm here today representing SEIU overall in Oregon, but also just working families. I want to first start with frontline healthcare work. Some of the stories that we're hearing from nurses and ONA has listed up is that, hospitals are in a crisis around PPE and trying to make sure that there's hand sanitizers and soap and water. There's a report from a hospital out on the Oregon coast about telling nurses they have to reuse plastic face shields and put foam on them instead of actually be properly sterilized. These are the types of stories that we hold as we think about healthcare workers. But it's also important as we think about the healthcare system, we think about doctors and nurses, but also the CNAs, the housekeepers, the nutrition service workers, the pharmacists. It takes this entire group of people to run a hospital, and they are on the front lines. And they need access to paid sick leave and also good health care, which is often not the case at hospitals across the state. Priorities for these workers are definitely PPE training and safety protocols. And as you've heard, as I just said from the stories, that's just always not the case. The reality is that this crisis lays bare to many of the challenges that the system had before the crisis, specifically around staffing, and we must continue to address those. We also know that we can have better outcomes right now because we really have been experiencing this with Kaiser. They are really making sure that we're uplifting the workers in this. They're providing 2 weeks of paid administrative leave to employees who are being quarantined. They have an incident command center contacting each work site so workers can bring forward concerns for quick resolution. They're doing weekly calls, one national and one regional. These calls are with the Kaiser union leaders and infectious control specialists who give updates and answer questions in the moment to give workers security. They're having transparent communications. Making sure that there's a COVID-19 dashboard to track cases by region and sharing that with union leaders to make sure that workers have that information. And Kaiser's paying housekeepers double time to come in and cover shifts. And they've established greeters to isolate and direct patients. And this is an example of where this can happen and how we hope that other employers can be lifted up to do the same thing. We represent a lot of long-term care workers, and these are both workers that care for the elderly and the people with developmental disabilities and physical disabilities, and they need to be in this moment considered a part of the healthcare essential personnel. Clearly, we need facility staff to care and support individuals and keep individuals safe and see how quickly it can spread. But there's also a network of over 40,000 in-home care providers in Oregon that need to be able to do their jobs, or some of the most vulnerable people in our state are not safe. We actually have to be proud of a system that we have in Oregon that's built on keeping people in their homes for as long as possible. But for that to be successful, we need to make sure that they can be cared for during this moment. I woke up Monday morning to a member named Brittany talking about how she was let go from her consumer because she had to deal with childcare and she was trying to rearrange her hours. This is true for her consumer who needs to make sure that they have the care they need. And Brittany, as a provider, I'm now going without any job effective immediately. The reports of long-term care workers going without PPE and facilities have been told to fend for themselves, trying to get it because they're not a part of the kind of healthcare, the hospital system that needs PPE. How do we make sure that facilities providing long-term care are seen as a part of that network to be able to get it? And we've had sets of workers report that they were being forced to wear garbage bags on their feet, and in others to try to make sure that they're keeping themselves safe. Also, long-term care workers are low-wage workers. If we want to make sure that they can stay home when they are sick, they must have sick leave up front, and their PTO is often very small. And that is a really big challenge, is how do you make sure people can proactively stay home when they're sick in a community of who rely every paycheck to pay their rent. We have just worked with Avamere, one of the largest long-term care facilities in Oregon, to create a new PTO bank that ensures workers have hours for when they need it and also free testing. This is an example of an employer stepping up and trying to make sure that workers are covered. We must be supporting employers who are working to do the right thing. We need to create policies to support their workers to make sure that they can be seen as a part of the frontline infrastructure in this crisis. For janitors, they really, in addition to kind of personal responsibility, janitors may be society's best hope for stopping the spread of this virus right now, putting them very directly on the front lines. So many times we overlook the important work janitors do, not reflecting on how our office or school or our buildings get cleaned. But this crisis has highlighted the critical role they play in keeping communities safe and secure, and they don't get the benefits or the pay to reflect that role. Many janitors don't have access to health care or sick days. Even janitors at places like the airport don't have access to adequate health care or paid time off. We need to make sure that we're thinking about the risks these workers are taking, they're getting supported to do the work, and that they have the security they need if they do get sick. When you think about public workers, you often think about state, and I want to give props to the state for making sure workers can telecommute in all the places they can and be safe and feel cared for. But public workers in this crisis are essential, whether it's case managers caring for the elderly or people with developmental disabilities, the unemployment workers, employment department workers that you all talked about, needing to make sure that there's plenty of them to process claims, child welfare workers trying to keep kids safe, but also driving for hours in a car with kids, putting their own health and their family's safety at risk. All of these are the realities of public workers who are needed in this moment. Government is more important now than ever, and the essential services it provides do not stop when the coronavirus threat starts. The challenges for many counties, cities, and the state is that technology is so far behind in government that telecommuting in some places is nearly impossible. We had a worker yesterday call in to say their local government told her she can't commute right now, but maybe in 3 weeks they can figure out how they can help telecommute. So we have workers in many governments working in unsafe working conditions, not being able to follow the guidelines that government has set out. We had a worker in Jackson County reach out because they were told they couldn't telecommute if they had kids at home. I'm not sure what people are supposed to do with their kids. And also have a report that sanitizer is only available if you bring it in, but not provided by the employer. All these reports are really concerning because government workers are at higher risk because they're interacting with the public, and that public needs them to be there to have their back in this moment. This is an example. What Graham and I just went through is workers, but there's so many more. There's so many more workers that have been organizing. We've been organizing workers at the airport in this country, and at PDX, where cabin cleaners and passenger service workers make low wages and don't have access to health care and no paid time off. And nationally, as there's an airport bailout, these workers need to be considered, and contracted workers need to be taken into account. It was brought up by committee members earlier. One of the most impacted sectors of the workforce is the gig economy. Workers who are often combining multiple gigs to make ends meet are particularly susceptible to the impact of COVID-19. Because of the employer choice to classify these workers as independent contractors, they are categorically excluded from labor protections and benefit programs. The state should create a fund to fund these workers who are excluded from unemployment insurance and workers' compensation to make sure that they have the cash assistance they need to get through this. There are also many other workers, and I also want to lift up what was brought up before, small business owners who are going to have to close their stores and restaurants. They need access to services just like workers do. Many small business owners don't have the health care and are missing the safety net they need to be able to make through this. So we want to, reiterate that we've been working closely with committee members in governor's office and others that we can to be able to lift up these issues. We also believe that right now the federal government has a responsibility, and ideally we'll be able to start to put in resources to lift working families up. But we do think government needs to be innovative and bold, and employers also have a role to play. Clearly, some employers are struggling through this, and then some other employers have an opportunity to really step up and help employees. We've been working with a coalition of community groups and labor groups to put this together. As Graham noted earlier, there's materials online, and there's a more detailed outline of the things I'm about to cover. But our main goal is that employer relief programs shouldn't leave workers behind. There's no doubt that the impacts on our economy will be felt for months and likely years to come. And there's no question that we must find the resources to support small businesses so they can get back on their feet, and that larger industries may need support as well. However, as state and federal governments grapple with economic recovery plans, there must be clear expectations that any employer receiving public funds must meet basic labor standards to ensure their workers are also uplifted out of the crisis. Some examples are ensuring that employers are providing paid time to employees that are unable to work and not hindering the process of unemployment or worker compensation claims. And we don't think that rolling back protections at this time should be considered. These are the big 6 buckets of maybe caring for our most vulnerable. I want to appreciate the comments of the committee members talking about unemployment. We completely agree that this is a place that we should be bold. Waiving the 1-week time period, making sure that people can get unemployment if they lost their job because of child care access issues, allowing unemployment to supplement 1/3 of PTO benefits, covering gig workers, covering people if they're out because they are sick. Unemployment should try to support every type of worker, including small business owners and undocumented immigrants. This is a place where we can put money in people's pockets. It will matter a lot when people are trying to put food on the table and make rent. And the question should be, how can we go as far as we can here to make sure that this program is working for everyone who currently is impacted by this crisis? We appreciate the comments earlier about the work being done on workers' compensation. We also believe this is a place that needs to, that the faster we can get out rules about how workers' comp can be a safety net here for frontline workers, and really thinking about who are those frontline workers. I would argue that while yes, hospital and long-term care workers should be included in those definitions, so should be potentially janitors and other workers who are on the front lines of this crisis, to make sure that they have access to workers' compensation if they're in a situation where they're not able to follow all the best guidelines because of the job that they do. Prior to COVID-19 hitting Oregon, we knew that 3 out of 4 low-income households pay over half of their income towards rent, which leaves very little left over for anything else, including an emergency. With business shuttering and people being laid off work, the lack of housing will have an immediate impact on housing stability. And we are hoping to lift up the recommendations from the Housing Alliance and other housing advocates, which includes providing immediate housing stability for folks. Child care has been brought up in this committee. This is a big deal. We appreciate the governor's executive order around how to make sure that frontline workers can get access to child care. But we need to make sure that we are figuring out how families access child care and continue to be able to do the work that they need to do, especially essential personnel, and that includes a broad definition of essential personnel. So we really hope that we prioritize the needs of our healthcare workers, but we're also taking, we support the actions that have been taken by DHS related to ERDC, and we want to continue to be creative. It's a big deal. I'm proud to be in a state where we have broad Medicaid access, but I think we've heard people bring this up, that affordable health care should be provided to all workers. And as people are losing their jobs, that means that they're losing their health care potentially. And how are we making sure that OHP is there to pick people up immediately? And also, how are we making sure that we're trying to make sure that the costs related to this in terms of an individual family does not bankrupt them? If they get sick or worried about their copays, then they're going to continue to go to work sick. So cost has to be something that we're looking into how we prevent this virus from spreading, making sure that people can think about how they take care of themselves and their families. And then also, we're also just really thinking about how do you think about food assistance, and how do you make sure that people have the access to food that they need, and making the school districts should be lifted up for all the work they've done to continue to make sure that people have the food assistance that they need over the last couple of weeks. How are we making sure that as the federal guidelines come down that is allowing more food assistance to people who are on free and reduced lunch, how are we quickly getting that in their hands and making it something that we're moving out really quickly? And, as the federal laws are coming in, how do we make sure we're, waiving the work requirements for TANF, trying to waive face-to-face interviews whenever possible? Those are the types of ideas that we need to move so that we can get assistance in people's hands as quickly as possible.
Thank you.
So that's kind of like some of the 6 buckets of area as we think about how are we taking care and lifting up people through this crisis, both people who are working and people who have been laid off. We need to make sure that that's a priority. We also need to be really, I think we've talked about this, ensuring essential personnel can do their jobs. The Oregonians who are stepping up during this crisis need to make sure they can do their job safely. This requires trying to be creative and figure out how we can keep up staffing levels, which is very hard. How are we making sure that essential personnel includes some of the workers we've been talking about, grocery store clerks, janitors, personal support workers, who all are going to have to continue to do their jobs, and in some cases at a very large scale, and that communities need them to be able to do their jobs.
So,
so we
Melissa,
really need to
can you wrap up, please? Are you about
going to
finished
wrap
now?
up? I have two more things. So we have this all in the presentation, but this is a big piece of what we think is really critical. And then the last thing we want to say is that information is super important for workers right now. The employment department being a warehouse for information, how does that happen? You all were talking about how are we bringing industries together? That is key. How do we make sure that there's non-English speaking information? How is there a worker hotline? How is information all centralized? This is a key part for people to understand this crisis in this moment.
Thank you.
That we can wrap up there.
They ended with yours. Honest communication.
I appreciate the extremely comprehensive look at workers. It deserves a very close look, and you've asked a lot of the questions, or posing a lot of the questions that we are posing as well. So thank you very much for your presentation. I've got about 11 minutes left, and I want, before I have to put Pat Allen on. So questions of this panel?
I just have a quick, Chair.
Senator Steiner Hayworth,
Really quick, I just want, if people didn't know, the President invoked the Defense Production Act an hour ago, and so that should help with the personal protection equipment challenges, because that way we can get local, U.S. factories working hard to get more of that. So I just wanted to put that information out there for the committee.
Senator Bowles.
Thank you, Chair. I just had a quick process question. So we have 10 minutes to address the rest of these issues, and then the Pat Allen will be here at 12:30 and until 1 or 1:30. When are we?
12:30 to 1 for Pat Allen.
And then is there something else at 1, or are we done?
We're going to finish up the rest of our panel that we haven't got to yet, and I was hoping we'd get to Sandra McDonough before we have Pat Allen come in. Sandra McDonough, I've got a hard start for Pat Allen at 12:30. We can either let you get started and then break if you're not done.
Okay, I will do my best to cover what I've got in 10 minutes, if that works for you.
Good job.
It certainly would, but we want to make sure you get your points out as well.
Great, thank you. Chair Roblin and Chair Holby, thank you very much for having me here. I've asked your staff, Dan Raposa, to run my slides so I don't commit any major technical errors, so I will tell him when to move the slides. I'm Sandra McDonough. I'm President and CEO of Oregon Business and Industries. We have about 1,600 members throughout the state and representing about 370,000 workers in Oregon. So I want to start by giving you a bit of overview. Like everybody else here, next slide, Dan, thank you. Like everyone else here, I am hearing from businesses pretty much every hour
And I'm going to tell you that this is a broad crisis that's impacting every community, every industry, and businesses of all sizes. And I would say that from your business community in Oregon, they started to feel the effects several weeks ago, starting with our international companies, particularly those doing business in China. I heard in early February from one of our members in Southern Oregon who makes medical products, who was having trouble accessing markets in China despite this incredible need there. Several global companies started having problems accessing supplies and delivering products. And then the retailers and others were feeling that, and we saw it with the Memphis shelves. But nothing hit like when the coronavirus actually hit us here in Oregon. I would say that in my time of working with business, I have never seen the level of concern that I'm hearing every day from businesses all over Oregon. And they're worried not just about the vitality of their businesses, but about the well-being of their employees and their customers and their ability to protect jobs over the long term. I think you're going to hear later about the staggering impact to the restaurant and lodging industry, but it's not just them. I got an email Friday from a small retail store in Ashland, and until Thursday they said they were a mom and pop operation with 4 part-time employees, and starting on Friday they were just a mom and pop operation and nothing else. That was a residual of the sharp decline in sales at the Oregon Shakespeare Festival, and this couple didn't know if they were going to be able to save their 26-year-old business. Last night, I heard from a linen company in Washington County desperately seeking an emergency loan. An event space in Portland told us they had lost $42,000 worth of business in just 3 weeks, and last Friday they laid off 2 managers and had cut the hours of others. And this morning I heard from a security company that in the last few days lost $106,000 in revenue because of canceled events, and they were expecting to lose another $500,000 by the beginning of summer if events did not turn around. I would say that our small businesses have been devastated, and the level of fear they're expressing exceeds anything I heard in 2008. Their biggest issue, without a doubt, is cash. Sales have dried up, and they need money to pay their employees and keep their doors open. I'm going to say we're hearing a lot from small business. We're talking a lot about small business, but it's also medium-sized and larger businesses that have been impacted. In fact, while we've been meeting today, I got an email from the CEO of one of Oregon's much-loved retailers who has already laid off a number of employees. I would call them more medium-sized. And this person said, I can't think of anything that will help except not having to make any non-essential cash payments. In order to start regular business again, I need only to have to pay wages, insurance, utilities, and basically nothing else. So this is across the board. We're hearing it from large businesses where grocery stores have changed their hours to accommodate employees who aren't available and to give them more time to stack shelves. And we're seeing people who are making a lot of moves to try to accommodate staffing issues, and the focus is on keeping people working as much as we can. So next slide, please. And I would say the priorities of Oregon, first of all, a lot of businesses have already taken steps. I was on a call yesterday with about 30 larger businesses, and I would say that all of them who were able to have employees work remotely have instituted remote working practices. The great need that we're seeing in our community. Okay, next slide. So our priorities are, first of all, protecting the health of all Oregonians. We support the bold moves that the governor has taken. We think this is what we will need to get through this crisis. We want to make sure that our workers get paid and that we can maintain benefits, and that's where this cash flow issue that we're seeing is so important. We want to make sure people can get their time off. And we also believe we have to be thinking about the long term. If we see a big decline in business today, if they're laying people off, if they can't maintain their operations, we're very concerned that these businesses may end up closing down and may never come back, especially many of our. So next slide. Thank you. We recently sent a letter to the legislature, and we filed it for this committee hearing today, that represents the thinking of more than 30 different business associations. We came together and developed a list of what we think are important near-term items that can help address this crisis and help us in the very near term protect jobs, keep getting people paid, and then ultimately allow us to save our jobs over the long term. So I'm going to walk through some of those for you. Okay, next slide, please. First of all, we want to make sure that we protect the unemployment insurance fund. This is very important, particularly as we're seeing layoffs happening, that more and more people are going to be turning to this fund. And I'm told that they typically get about 2,000 applicants a day, when a company like, a week, 2,000 a week, when a company like McMenamins shuts its door and lay off employees, you're going to get that many in a few hours. So we're concerned about making sure that this fund stays available to employees over the long term. We're suggesting that you consider investing the corporate kicker in the unemployment fund, and you also make it easier for employees to access the fund quickly. We talked earlier about the 1 week waiting period. There's the job search requirement. We think this is the time to at least temporarily rethink some of those long-time practices and make it easier for employees to have access to revenue. The federal government said the other day that unemployment could reach as high as 20%. We don't know. We've never had an experience like this. But I think the highest the unemployment rate in Oregon got during the Great Recession was 12%. So we've really got to make sure that the unemployment insurance fund is there for us for the long term. Okay, next slide. And then the issue of cash. And I will tell you, this is a real issue. We've had many companies close down because of the orders from the governor, others that are having the residual impact and having to lay people down. Companies across Oregon are experiencing severe cash flow issues. And when you're particularly a small business, you don't tend to have a whole lot of cash on hand. So if your monthly revenue dries up, you're in a world of hurt, and your first priority is always going to be to pay your employees, and if you can't do that, it results in layoffs. And so as a collection of business associations, we respectfully ask that you consider delaying the first quarter payments at least for a delayed CAT implementation, at least in the first quarter, and potentially the second quarter if we haven't seen this get resolved. And I'm going to tell you, this is not something we got too lightly. It is not something we're doing because this is a tax that business doesn't particularly like anyway. This is real. We have people who don't have the cash to keep their operations going, keep their people paid, and for them to have to write a check to the government when they can't even make payroll is something that I think we have to stop and consider and look at delaying this tax. The rules aren't done yet. It makes sense to delay that implementation at least for a while. Businesses need access to money, and so we hope that you would direct Business Oregon to work with financial institutions to help businesses get access to low and no interest loans and give them the ability to defer payments through this critical period. And finally, we need some small business assistance. We've suggested that you create a small business concierge or some other place where small businesses can call and get directed to the agencies that can help them quickly.
Sandra, thank you. Thank you. I'm going to have to stop there. I really need to get Director Allen in this time slot. If you want to wait, we can come back to you to finish up if you wish. And that will probably be about 1 o'clock.
All right, thank you.
So, committee, I want to get Pat Allen on to give us the update from the Oregon Health Authority in this particular time frame. He's got just a hard stop at 1 o'clock. So, Mr. Allen, thank you for making yourself available. And I'm just going to give you the floor.
Great. Thank you very much, co-chairs, members of the committee. Patrick Allen, Director of the Oregon Health Authority. Just want to confirm you guys can hear me all right?
Yes.
Perfect. Thanks for the opportunity to brief you today. I'm going to cover a fair amount of ground fairly quickly and then save some time for questions that you might have. Clearly, we're in the initial phases of what's expected to be an unprecedented healthcare crisis. And I want to stress initial stages. This is a situation that will not last for weeks. This will last for months and potentially a lot of months. Current modeling of the disease shows that the number of individuals in Oregon requiring a hospital level of care may exceed the amount of hospital capacity we have in the state in the next short weeks, and that stress could continue. Let me give you just sort of a rundown of where we are in terms of some of the numbers. Today we have 75 positive cases in the state. That's up 28 positive cases from 2 days ago. We have tested over 1,200 people, and our rate of testing now is on the order of 1,000 to about 1,500 tests per week. And so as private sector testing capacity has come on, that has increased substantially. A critical area that we're concerned about is our supply of personal protective equipment and the rate that we're burning through that. So let me just give you some brief numbers. N95 respirator masks. These are the kind that are for airborne hazards. We started out after you allow for some reserves for tribal and state institutions. We started out with about almost 590,000 of those. We've used 28%. We're down to 421,000. Surgical procedure masks, we started at 49,000. We've used 2/3 of those and have 18,000 left. In terms of surgical gowns, we started with 23,000 and we have burned through 83% of those. And there are other details here I can provide if you'd like them. The point is, I got asked yesterday, I think on a legislative call, are we running out of PPE and we don't have a plan B? Plan A has been that providers would access their ordinary suppliers and restock and production would ramp up. The challenge, of course, is that those suppliers are generally in China, and China has prohibited the export of personal protective equipment and other medical supplies, and of course has been demanding a lot itself. Plan B is our state stockpile, and we have been distributing out of that stockpile for the last 2 weeks to dozens of providers of all sorts all across the state. And we can see with these burn rates that that's got a finite length of time. Plan C is to access national stockpiles through the Department of Health and Human Services, and we have done that. And so far, we've received 10% of what we've asked for, with a promise of another 15%. Plan D is to access, due to a federal emergency declaration, stockpiles that exist with FEMA and the military, and we've seen no information or any movement of those stockpiles. Plan E, which we are pursuing now, is to look creatively in our own backyard in terms of either PPE that's available in non-medical environments, things that you wouldn't think of as PPE but could use them out of, for instance, high-tech manufacturing, and to see if there's any ability to ramp up our own production of PPE. The problem is, while pursuing all of those things in the absence of a significant federal change, we're going to run out of personal protective equipment, and there's no Plan F available for us to access. I'm deeply concerned within the next short weeks we will have providers who need to treat patients without masks, without face shields, and those kinds of things. That's a critical problem. Let me turn to some of the other work that we're doing right now. First, just to point out that a backbone for this work exists. We've been working for about the last 10 or 15 years as we've had different kinds of disease threats affect the state, from SARS to H1N1 to Zika virus to Ebola. Building out the base infrastructure of how you respond to this sort of a circumstance. So the state stockpile actually dates back to H1N1. We have a high-impact pathogens plan of operations that's been in place for a number of years. We have a crisis care guidance structure that basically is the structure you use to make decisions when you start running out of medical resources. And we're implementing that now with, or building that out now with some task force work that I'll talk about. The bottom line is we've got sort of the bones, and now we're working as we see the shape of this particular disaster to put the actual tools in place on the bones. We've received resources in the form of an initial $500,000 from CDC that's been augmented by another federal appropriation for about $7.5 million. Most of that we have in turn pushed out to local public health authorities, which are really on the front line of doing this work. And then you all appropriated $5 million out of the, or allocated $5 million out of the emergency fund to us, and that has been very helpful. We're working very hard to make sure we're addressing the needs of all Oregonians. We've conducted significant outreach to immigrant populations to assure we're broadly conveying messages that accessing health care is not implicated in the public charge rule. We have a weekly call with 2,000 community partners in both English and Spanish to help them understand messages and be able to push communications out to the communities that they work with. We're trying to increase access to telehealth for behavioral health services. We have a focus on those with intellectual and developmental disabilities and individuals who utilize home health care, working in partnership with the Department of Human Services. And there's a statewide homeless populations task force focused on those who are unhoused, either in shelter environments or on the street. That's one of the populations that we'll focus on in the task force work that I'll describe in just a little bit. So let me talk about the challenge that's really right at hand for us, and it's this. We have worked with the Institute for Disease Modeling and experts at University of Washington and at OHSU to model where we think we're going to be in terms of people getting sick and people needing hospital level of care. You've probably by now heard the phrase flattening the curve enough times that you're relatively sick of it, but let me just quickly talk about what that is. Any kind of a disease has an epidemiological curve, and it's a bell curve like anything else, where at first a few people start getting sick, then a few more, and then all of a sudden a lot. And we're really we've been at sort of a steady state with numbers that are quite small, and that number now is beginning to take off. If that bell curve is skinny and has a big peak in the middle, what we know will happen is we will quickly exceed the capacity of hospital beds, ICU beds, ventilators, and skilled staff to be able to meet that need. And hard decisions under that critical care guidance plan will need to be made about who does and who does not get treatment. And so the idea of the social distancing steps that the governor has ordered is to take that skinny bell curve and turn it into a flatter bell curve so that the peak isn't as big and you have a better chance of driving down the amount of demand for those healthcare services. And so all of the things that we've been trying to do, as grievously hard as they are for the economy, are single-mindedly aimed at that notion of making sure we don't run out of hospital capacity. At the same time, we're also trying to do work to increase the capacity and make sure that we can preserve it. And again, I'll talk about that in the task force work. But that really is kind of that's the organizing force around all of our work right now, is drive down demand for healthcare, drive up the capacity of the system to be able to meet that. Let me go ahead and talk about the Joint Task Force on healthcare system response. It's aimed with sub-work groups at 3 specific areas to try to address what's going to be coming. We have a work group on vulnerable populations, which is a fairly broad category. It focuses on people in long-term care and other forms of congregate care. That's long-term care facilities, skilled nursing facilities, assisted living facilities, group homes, residential treatment programs, anywhere where you've got groups of vulnerable people congregated together. What we have seen certainly in Washington and now we're beginning to see some signs of in Oregon is that in those facilities with vulnerable populations, it's very hard to stop an infection when it gets in. And we know that vulnerable populations are uniquely at risk for severe consequences from COVID, and so that's an important population for us to focus on. The second is hospitals and healthcare systems, and it's basically that work of how do we provide extra capacity. On Friday, we're standing up the Oregon Emergency Medical Facility at the state fairgrounds. This is essentially a mobile hospital facility that the state has, that OHA has, and we'll be getting that up and running. We're working with a number of the task force will focus on things like, are there licensed beds that exist at hospitals that aren't being operated that could quickly be put into use? This is especially true in rural communities. Are there facilities like hotels, dorm rooms, those kinds of things that could be converted to different kinds of care? Are there facilities we can literally stand up in parking lots? The idea is to focus on 3 different kinds of care that can be provided in these alternative settings, what we call step-down care. Someone who's in the hospital today would likely be ready to move to a nursing home, but because that system is locked up with the challenges of preventing infection in the nursing home system, can't be gotten out and into a placement like that. Can we provide a hospital-like setting for that person to continue their recovery? Hospital diversion care. Are there facilities that we can create, and these may be in some cases the same facility, but are there beds that we can create where someone would show up who ordinarily would be admitted to the hospital, but in this circumstance can be appropriately cared for in an alternate environment? And then what we would call recovery care. The idea that there are people who don't really require hospitalization, but whose living circumstances don't allow them to be able to get well in the environment that they're living in. Someone who's living on the street would be a good example, but there are others, people who have roommates and no ability to isolate, kids in college dorms if it comes to that. The idea is to basically within the next 3 to 4 weeks stand up as much of that kind of collection of care as we possibly can. It's also going to involve a significant staffing lift, and so when we start thinking about budget implications, one of the asks that we'll have will be for resources to be able to hire people who can staff that work, which may also be an opportunity for people who've recently lost their jobs to have opportunities in that environment. I think those are the main things that I wanted to. Let me just say one other word about structure. We've been operating this emergency for about three and a half weeks as an incident that's been managed by OHA. As this incident has grown, we've pulled in more resources from across OHA and from other agencies. I will tell you, for those of you on the committee who follow the healthcare work that we do, we're gradually slowing down and stopping almost everything that the agency does that's not related to COVID, so that we can send resources into this incident. And so things like cost growth targets, Medicaid buy-in, universal access, bunches of other things we're trying to kind of put on the deep freeze right now so that we can devote all of our resources to this response. With that, I'd be happy to stop and see if you have questions.
Thank you, Mr. Allen.
I have a question.
Senator Gelser has a question.
Thank you. Pat, on the call yesterday, we talked about the impact of social distancing on families. Can you clarify what the health authority's position is on things like shared play dates at parks, or having sleepovers, or having a single family that you have play dates with? Does the health authority have specific guidance on play dates?
We have not issued specific guidance on that, but I saw the piece that you forwarded to me from Pennsylvania that looked very good. As a general matter, I would say the point of the school shutdown and the point of social distancing is for people not to make contact with each other. And so we'll take a look at that Pennsylvania guidance and see if there's something that we can put out that's much more specific on that point.
Thank you.
Senator Finley, I have a question.
Thank you, Mr. Fisher.
Sure.
Representative Salinas is next, and we'll get right back to you.
Thank you.
Director Allen, you mentioned a couple things. One is the telehealth issue, and then that'll lead me to a second question. But on telehealth, I was just wondering if you're considering what the licensing requirements and the loosening of those license requirements looks like, and then in terms of trying to utilize the healthcare workers that are in state first. And then that leads me to my second question, which is around payers. So whether it's public payers or private payers, who is going to be paying for that telehealth work? Are those discussions taking place? And then whether, we are looking at in-network, out-of-network, I don't think people are really going to care whether they're in-network and actually need to seek care. So
Right.
You're working with
so the rules around Sure. So the rules around telehealth are a little bit arcane, and I am not expert in them. My understanding is that we have focused primarily on the rules around the Medicaid system, where to the extent that those have been a barrier, and we've opened up codes and removed requirements around the degree of supervision or someone having to be physically in a particular location or those kinds of things. And my understanding is those have opened that system up significantly. We've also been working in close partnership with Department of Consumer and Business Services in terms of the commercial market to identify ways that we can, again, open that system up and make it more accessible to people.
So I know there's somebody on the web that wanted to go next.
Eastern Oregon.
Finley?
Finley.
Oh, was it Finley? Finley, are you still there? Rep Senator?
I am still here. Thank you. Thank you, co-chairs. I have a couple of questions. Thank you, Director Allen. I sit here and I live very close to Idaho, and Idaho has instigated and instituted a drive-through checkout or drive-through testing procedures. And I'm wondering, has Oregon done that? And what are the plans to do that within Eastern Oregon? And you talked about additional facilities coming online. Where's the staffing for those facilities going to come from? Because all of my medical facilities in my district are telling me that they are well understaffed now. So I have grave concerns that we're building a model that we're not going to be able to execute without staffing.
Sure.
I was curious about that.
Yeah, so let me take those in reverse order because I think it helps answer the testing question. In terms of staffing, that is part of the work that these work groups that will launch in about 10 minutes will do. But the general idea is I would describe these as hospital-like beds, and we're trying to create staffing models that are not as intensively dependent on professionals. The idea, of course, is that we're putting people into these beds who in other circumstances would end up in a nursing home or in their own home or other circumstances, and so we're not really talking about a hospital level of care, but we are talking about care. So the idea would be fewer medical professionals, more non-professional staff that we would hire, and then we do have the ability to access Servor, which is a volunteer corps of trained and licensed professionals, as well as the Medical Reserve Corps at the local level, to provide access to often retired medical professionals, other people who have basically signed up to do this kind of work in crisis circumstances. So our plan will be to access those sources of professionals, pair them up with people who we can hire to be able to do work, to be able to staff those. Now, that leads directly into the issue of drive-up testing. What we're trying to focus on is the volume of tests and getting as many tests done as we can. And that number is ramping up incredibly quickly. We were at a place where when the state lab was the only testing entity available, we were able to process about 80 to 100 or 120 tests a day. And today, as I indicated earlier, we're over 1,000 tests a day, more like 1,200, and that number is continuing to increase rapidly. What we really want people to do is not think in terms of, I need to be tested, but I need care. If they feel that they need care, they need to call their provider and talk to that provider about whether the provider wants them to come in and be seen, not come in, divert them to the hospital because they're very sick, and then the provider will make a decision about whether testing is appropriate. To do drive-through testing requires a huge lift in terms of the very staff that you were talking about that we don't have access to. We need to be able to have people staff those facilities. And given the current climate around testing, either we need to have them not be publicly known and aimed at very specific target populations. And we've done some of that in Oregon already with drive-through testing in Lynn County around the Oregon Veterans Home, in Multnomah County around testing teachers that were related to the very first school exposure we had. But if we sort of do a general y'all come kind of a testing circumstance, we've not only got the logistics of doing the testing, but we also then have to figure out how do we match those people up with care providers. It would really be highly problematic to simply take a test, get a result, and send them a postcard saying you're positive with COVID with no other guidance than that. What we would really worry about is that would cause itself a rush to the overburdened healthcare system, often from people who don't need medical treatment. And so we'd rather have the consultation with the care provider be the first point of contact rather than the test. And then, of course, the other thing is I'm concerned in the current environment that we would also need, as part of this emergency, to have a significant police or guard presence to be able to just handle crowd control. Looking at circumstances in Colorado and elsewhere where they've done this, and it's gotten pretty difficult to manage. So for those reasons, we're focusing on trying to increase the number of tests through the most targeted populations we can.
So I need to move to Senator.
Thank you. Follow up.
Senator Finley, I've got 5 more people that want to ask questions and 8 minutes to do it in before Director Allen's going to be off on his next meeting. So I'm going to move to Senator Steiner Hayward. If you have questions that you didn't get answers, write them down, get them to Jan Nordland, and we'll follow up with those questions directly to Director Allen.
Mr. Allen, thank you. One of the questions about telehealth has to do with peer-to-peer support for people in mental health crises or in drug and alcohol recovery. And that has historically been required to be a face-to-face service, which clearly we do not want to have happening right now, but we do want to support people whose mental health challenges or risk of relapse into drug or alcohol use is likely higher at the moment due to levels of stress. So how is OHA thinking about that particular population and their needs and making sure they get supported properly?
Yeah, we have open codes in the Medicaid system to make that available for those on the Oregon Health Plan.
Thank you.
Representative Evans.
Thank you, Co-Chair. I have 3 questions, and Pat, because of time, you can send them to me or send them to Jan. That's fine, but I want to make sure they're out there and you have time to find out. The first is, New York is currently looking at ramping up their healthcare provider beyond the first step. They're going to medical schools, looking and trying to reach out to retired medical folks who aren't a part of Servor and things like that, because the recognition that after the first month of an all-out rush, there's going to be a collapse of some of the folks who are providing the care. So are you guys looking beyond just meeting this first wave, but preparing to try to have a workforce for 6 or 9 months? That's one question. The second question is, when you talked yesterday, and I want to clarify, on the phone yesterday you'd said that we got into 1,000 tests per week, which wasn't a whole lot more than that.
Oh, did I say per?
Yesterday on the phone call you did.
Yeah, did I say per day today? I meant per week. I apologize.
So it is 1,000 per week right now?
So we're at about 1,000 to 1,250 and continuing to increase per week, yes.
Because at 80 a day, that's about 560 per week. So we're double it, but we're still not getting to the 1,000 per day stat that we're hoping to get to. Is that correct?
I wouldn't say we've targeted 1,000 per day, but we're rapidly increasing. I would expect to be at 2,000 per week shortly.
Okay, and then the last question, I know it's a complicated time, but could you guys provide a flow chart or an operational chart of who is the incident command? I get the unified command structure, but I'm still trying to figure out who's in charge for what aspect.
Yeah, we've got a detailed organizational structure for the entire incident, breaking down emergency coordination center and OHA incident management. We can get you that org chart.
Appreciate it. Thank you. Thanks for what you're doing.
Yep. Thank you.
Representative Barreto.
Thank you, Mr. Co-Chair. Thank you, Director Allen. A couple questions, and you can send these to Jen too, but just based on the history, the current history we have now, how many of the people that contract this virus will require hospital care? And then the second question is, without the protective devices of a lot of the providers, they are bound to get this virus, and how long will it take for them to recover and then go back to work, if at all possible?
Yeah, so the first question is easy to answer. About 20% of those who contract the virus require significant medical intervention. I don't want to say that's always hospitalization, but it's always hospitalization. And what I'm given to understand is somewhere between 5 and 8% required ICU level of care. And so again, that's why it's so critical to spread the peak out over time. How long someone is out of the workforce with this really depends on the severity of the case. And so the general idea is once you have been clear of symptoms, it's a little bit complicated because there are a couple of different dates, and it's the longer of kind of a circumstance, but it's about 10 days after you've been clear of the disease. And what I'm understanding is that the course of the disease tends to run about 1 to 2 weeks. So that kind of gives you some very, very rough parameters. Obviously, this is the kind of thing that varies highly from one person to another.
Thank you.
And Senator Bowles, you get a chance to ask your question.
I'll ask my question. Thank you, Chair Holvey. Pat, I have my questions around PPE, and I appreciate the breakdown of where we're at with regards to our supply. I'd love to have that emailed out as exactly where we are on these different issues. My question has to do with distribution, and what is the process specifically for distribution, and where has the PPE been distributed in the state?
Yeah, we'll get you a breakdown on that. My general answer would be we're getting dozens of requests from all over the state. The very first one was, I think, in Wallowa County. The next one was a large hospital system in the Portland area, and sort of everything in between.
So what's the triage
but we can get you more detail on that.
Is there a triage process?
Yeah, we have a formula. Yes, we have a formula that we use for distribution. We often contact the requester, particularly if the request looks particularly large, to figure out what's behind it. So that we can try to scale that. Nobody is getting everything they're asking for because we're trying to get this stuff to last as long as we possibly can, since there appear to be little federal resources to back us up.
One more follow-up. With regards to the new hospitals and the different things that are being set up, can we expect for the PPE to be siphoned off to these other areas before they get to the healthcare systems that are already set up, or what's that process look like?
No, I think they will be equally short.
Director Allen, I know you need to go off to your next task force or meeting, and really appreciate you taking the time to give us a update. We'll be following along, and appreciate all the hard work of yourself, your staff especially, and doing the best you can, and really trying circumstances. So I hope we're able to, plug in and provide some measure of assistance to helping your agency and the whole state to respond to this. Thank you very much for taking the time.
Thank you, and we really appreciate all of your support.
So, committee, I'm going to go back to Sandra McDonough. Is she still on?
I am, thank you.
Is now exiting.
Mr. Co-Chair?
Yes.
May I ask you to, after the meeting, consult with Representative Evans, and at the next meeting that we have, we ensure, and he will know how to do this, that we get a briefing on how the incident command system works, and we get a briefing on how the state response system works. 90% of the members I've heard on calls are not familiar with this system, despite Representative Evans and I living and breathing this, and that would answer a lot of the questions. It would also relieve a lot of questions if we had that briefing that we keep sending to Pat Allen and free up his time. We have an existing system that works, in a process that works, and I think Representative Evans could help brief you up to speed so you got it, and you would see how helpful it would be for members, and that may alleviate some of the misconceptions, scariness, panic, so on and so forth. The system works quite effectively, and it is officially up and running this week, and it is working. And so I think most members don't know that, and a lot of our anxiety could be helped by that briefing. Thank you, Mr. Chairman.
That's a good point. Thanks for bringing it up.
It's would be a perfect thing for the Friday agenda, so we'll need to put that in.
Could fit in for sure. So, anyways, excuse me, Sandra McDonough, you're back up.
Great. Thank you, Chair Holby and Chair Roblin. I will pick up where I left off. I was talking about the cash flow challenges that many companies, particularly small and medium-sized businesses, are facing right now. And for them, cash is everything. Just a few minutes ago, I got a copy of an advisory that the Department of Revenue has sent out reminding taxpayers that the first quarter of the CAP payment is due on April 30th. And they're saying that taxpayers, if they make a good effort to pay, will not be fined if they are not on time or are not able to make a full payment. But if you're looking at a business that had revenue perhaps in January or February and then little or no revenue in March, having to make a payment, the deputy is making the tax payment or maintaining payroll, and that would be a very, very difficult choice for them to make, and a delay isn't really going to help them. So again, the 30-plus business associations that came together hope that you will consider delaying CAT implementation in the first quarter and potentially in the second quarter if this crisis is not abated. So next slide, please. We think there's some other tax issues that you could address. The federal government and some other states have delayed their tax filing deadlines. We think that makes sense. And perhaps over a little bit longer term, if we could look at some incentives for employers who have stepped up and taken proactive steps to help their workers get through this so they can maintain payroll, keep people working, keep families from getting paychecks. So perhaps some tax credits for employers who have provided additional time off and incentives for employers to institute more remote work opportunities. You recall that I said that many, many employers, particularly large ones who can, have instituted remote work regimens, and as much as 90% in some places, I understand, are working remotely now. Next slide. We also think this is a time for state agencies and leaders to take a look at some of the regulatory requirements that perhaps make sense in this time of crisis. If we are trying to keep people working, we may need some more flexibility. So rules like the limits on manufacturing overtime, some of the predictive scheduling rules, those kinds of things. Perhaps we can look at some temporary changes or a moratorium on them to give employers flexibility to keep people coming to work and getting paid. I heard from some of my colleagues in the construction industry about training requirements that workers must have when they're supposed to be trained. So perhaps we could plan on those. And things like self-service gas stations, just temporarily, are there things that we could get that maybe we could delay, have a short moratorium on? Now, we also think this is a time that we should think twice about moving forward on new rulemakings that are not critical to addressing this crisis. Everybody is dealing with limited work staff right now, and it just might make sense to start prioritizing some of the work that we have ahead of us in rulemaking. So next slide, please. And then I'd say from the perspective of employers, the biggest issue besides just dealing with lost revenue and employees that short staff, it's really the uncertainty that's been going on. What next? And again, we appreciate that the governor has stepped up and made some really hard decisions and orders that are designed to protect Oregonians' health, and we absolutely support that. And we understand that it's not been able to do everything at once, that we've had, successive orders. But as we see what's happening in the rest of the country, we have to say what's coming back to Oregon. And the big concern that, frankly, I've gotten probably more than a dozen emails just in the last 2 hours has been about, will we see a shelter-in-place kind of an order like we saw in California, maybe coming to New York, and we know that other states are looking at. We heard from several companies operating in the Bay Area when this happened that it was not coordinated among the different jurisdictions that had this, and there was a lot of ambiguity about who was affected, who wasn't, what's an essential business function, what isn't. And I would suggest that this is the time when we should be actually thinking about how do we define what an essential business is. I've heard from insurance companies, from telecommunications companies, from different kinds of retailers and manufacturers and many others about wanting to make sure that we're thoughtful and we think ahead before there's an order about how we would define an essential business function, so we could maybe avoid some of the confusion and, frankly, a lack of productivity that we saw in the Bay Area and other places. And then I think we need to think very carefully about the treatment of manufacturers. I was in a meeting the other day when they were talking about the potential for a shelter-in-place order and what would that mean if manufacturers were included in that. And one of the businesses there said that if he was told to stop operation, the following day he would be laying off 700 employees. And if you think about that and multiply it by all of the manufacturing employees that we have in Oregon, we would really overwhelm our workers' compensation and our unemployment systems, and we really would need to be thoughtful about that. So I would hope that we could start conversations now about how do we make sure that we make it possible for people who can work to work, and in areas like manufacturing where they really can handle the social distancing, that we plan for that in advance and keep people working wherever we can. Next slide. And our partners in labor said the same thing. We really need to maintain really great communication on this. We're all talking to each other. It's been challenging, but we need to make sure there's two-way communications where we're hearing from our government leaders what's coming, and that we're able to share with them the real-time experiences that we are seeing from employers and employees about how this is impacting them. We have to understand by sector what the impacts of different businesses are, and to really be thinking not just about dealing with the crisis today, but how do we make sure those businesses are operating in 6 months and we will still have jobs and we don't end up in a deeper recession than would happen otherwise. And we have to focus on our small business community. They need special help. They're really, really hurting, and the cash issue is huge for them. And we need some near-term relief. They need to see right away that our government leaders understand that this has been a devastating crisis for them, and that they want to keep their people employed, and we need to be thoughtful about what they need today and what they need in 6 months, and maybe to start sharing some best practices for how we can deal with the immediate crisis and move forward. I will add on a happy note, I was speaking to one of our winemaking businesses the other day, and they reported that wine sales are up. So that may be a good thing that's come out of this, but otherwise, that was maybe the only good news that I heard in our conversations yesterday. So that's it. Thank you for your time, and I'm happy to answer any questions.
Thank you, Sandra, for being patient and picking right back up. That was great. Any questions?
I have a question. This is Senator Finley.
Senator Finley, go ahead.
Thank you, co-chairs. I have a question. There's a perception that business interruption insurance will cover a lot of these businesses when they shut down. And I've had some conversation with several businesses in my district that said that is not true. They have what they think is quality insurance, but this will not cover this type of a business interruption. Is that a true statement or not? And I do have a follow-up. So.
Well, I think, it may be different from the Haven. I think it may be policy, but I've talked to several businesses who have spoken to their insurance companies and reviewed their policies and do not believe they are covered. I think this may be one of those conversations that will be ongoing for months, but there is a concern there.
Yeah, thank you. And that's my understanding. Even though the guy thought they had the Cadillac of the insurance, it's not going to be covered for this, but they're trying their claim. And second is I've also heard that there's some poor or some arcane regulation that won't allow auto dealers to deliver cars to a home, that people have to go to their dealer to purchase cars. And that seems insane to me. Is that something that we should look at on trying to think outside the box to keep people more of it out of the public presence?
Well, Chair Holby, I haven't heard that one in particular. I will be happy to make some calls and follow up with you about that.
Thank you.
Representative
Thank you, Chair.
Thank you, Chair. Following along with Senator Boca's request, I wanted to make a request to have invited testimony from banks. I advised my husband to call our bank and talk about our business debt and making sure that we were in constant communication with them, and they fell flat on their face. They didn't know how to help us refinance or what options were available, whether it was, deferring forbearance, whatever it was, for 3 months, 6 months, and I thought that was unacceptable. So I think that the banks can do better. They got a good bailout 10 years-ish ago, and they need to step up to the plate and make sure that it's easy for small businesses and medium-sized businesses, all businesses really, to have a conversation about what their financial future looks like over the next 6 months.
Thank you for the suggestion. Don't see any other questions. Sandra, thank you very much. Oh, I missed one. Senator Boquist.
Just a suggestion for our state executive branch colleagues that are on board, if they're still on board, maybe the insurance commissioner might be able to help address that insurance issue, especially for our small businesses, because we're sort of, many of us have got in the mindset that and we've heard, half the people, we have heard it, that a lot of people are covered. We'll just say that, because we'll do after actions reviews later. And maybe the insurance commissioner has a grasp of that, or the type of policies or some sort of expertise that they can get involved. Not so much come to our aid and tell us at this point, but maybe help coordinate that at the EOC and those levels.
These are all good suggestions, and I think Senator Roblin and I will have to try to prioritize, what our most immediate needs will be in our next meetings. But we'll keep a running list.
That's one that really just needs to go to the executive.
Exactly. I'm not asking for an item, sir. I'm saying maybe we should, if our executive branch is listening, maybe that's a resource they could go get answers for and put out themselves.
Well, I think we have several questions around insurance.
Chair Holby and Chair Roblin, if I might, I just got a note, a colleague who represents the auto industry who told me that Senator Finley's question is real about car delivery, and they are trying to get that addressed.
Yep. Thank you. So I'm going to go ahead and move on now to Jason Brandt and Greg Astley from the Oregon Restaurant Lodging Association.
Hello, can you hear me okay?
Yes, we can.
Chairs Roblin and Holvey, members of the committee, thank you so much for your time today. My name is Jason Brandt. I serve as the president and CEO of the Oregon Restaurant and Lodging Association. And accompanying me today is Greg Astley, our Director of Government Affairs for the association. I want to assure everyone that Greg and I will practice social distancing throughout our time with you today. Also, I want to thank the legislative staff for their technical assistance. Thank you, Jan, Dan, and Danielle for everything that you're doing to make this as productive as possible. I'm hoping that you can actually run points for our PowerPoint presentation similar to Sandy. Is that a possibility?
Yes, continue.
Great. Before Greg, Ashley, and I move through our PowerPoint slides, I want to convey two crucial points. An immediate infusion of cash for Oregon hospitality businesses and their employees is needed right now to sustain operations. This can be accomplished through ongoing federal coordination and an aggressive Oregon hospitality grant program. Secondly, we must consider relief through government action to protect hospitality businesses from fixed costs during the duration of the emergency. Deferring expenses without penalties for rents and utilities would assist with cash flow for employees we want to keep on our payrolls. With that, we'll move through the slides. And again, thank you for your patience. I know it's already been a very important meeting with a lot of crucial points. A little background on us. The Oregon Restaurant and Lodging Association represents about 2,600 members throughout the state. It's a very large industry, and I want to make sure that we think about the people, the tiers that we're hearing over the phone for the last week, the calls, the emails, the texts. This is an industry that has been unified for years between employee and employer. I can't tell you the amount of people out there that care so deeply for their employees. The last thing they want to do is not have a job for their employees. So I just want to make sure everyone knows that. We firmly believe that, and we're here to help employees while we're helping small businesses at the same time from an employer standpoint. There's over 180,000 jobs in Oregon hospitality. That's a pre-coronavirus number. So lots of jobs across the state. We're the second largest private sector industry in Oregon. We'll get into this, but you need to know in real time, thousands of jobs have already lost. We're doing our best to track that, and we'll keep you up to speed as much we can as an association. Some of the slides do convey the severity of the situation, and these slides are 1 day old, and things are changing in real time. You see some numbers there from restaurants and lodging statistics. I don't need to go through those, but I do want you to know the impact that it has on the overall economy and also the employment that our industry represents as a proportion of overall state employment. The lodging number is also important. Lodging obviously supports a number of jobs, 4.5% to be exact, throughout the entire network. Let's move to the next slide, and Greg and I will switch off voices just so you don't get too tired of either one of them. Greg?
Thank you, Jason. The next slide, please. Yes, the governor's office has already referenced this. This is information from Open Table on restaurants, and it's basically the same information, but I know people digest it in different ways. So on the far right, you'll see going back as far as February 23rd, from a year-to-year basis, reservations on Open Table up 20% in Oregon, 20%. And then as you work through the last couple of weeks, including the governor's executive order on Monday, it's now 61% down across the state and across the city. The line graphs on the left side, bottom of that slide, represent those same numbers, but just represented graphically for those who like to see it visually. So that information is as up to date as we have at this point, and provide more up-to-date information as we receive it. Next slide, please.
So the choice for restaurants is laid out the best we can in these three scenarios, just to give you a full understanding of what we're facing. And anytime we say restaurants, I really want to make sure everyone knows we're talking about 155,000 Oregonians. So restaurants, for the purposes of our conversation, equals 155,000 people that we're needing to work with to make sure they have a paycheck and can provide for their families. So the options are close for good, close temporarily, or number 3, lay off all non-kitchen employees to support the new efforts by the governor to continue frequenting restaurants, but in a controlled way with delivery and pickup. But that will not sustain the restaurant for long from a business model standpoint. So back to numbers 1 and 2. So how do we make that work? Obviously, number 2, in our opinion, is the only viable option. We certainly don't want to see the network of over 10,000 restaurants in Oregon that employ 155,000 people shut down for good. So what does this look like from a temporary standpoint? Well, I just want to read this because we've talked a lot about it internally and with many of our members. When we come out of this and the public does get the all clear, it's so crucial that restaurants, bars, breweries, and all of those tied to our industry be able to quickly open up their doors again, get their employees back to work, and start generating revenue again for the state and for the cities. At this point, we really do have no idea what the governor's announcement on March 16th will mean when it comes to how many restaurants fall into Category 1 and how many restaurants fall into Category 2. Next slide, please.
So this is just economic impact on restaurants, and I'm going to add one to this because I just got a text message this morning from a bar in Portland who normally would enjoy a very robust St. Patrick's Day. In fact, their revenue in the door would normally have been $50,000 just on St. Patrick's Day. I was texted a copy of their daily log sheet, and their sales for yesterday were 0. So you've already probably heard McMenamins has announced it's laying off 3,000 workers. We also heard from Joe Davis, the Black Bear Diner in Madras, Oregon, just north of Redmond, is laying off 38 of its 51 staff. Toro Bravo Group in Portland has laid off 90% of their workers and closed 5 of their 7 restaurants. They are trying to keep 2 of them open and utilize the food that they have in a way to help those in need. In addition, the Oregon Lottery just sent out notices yesterday that the video lottery machines will be turned off for the duration of the ban, which further reduces revenue sources for bars and restaurants, sometimes dramatically. There's a link on here to the Oregon Live restaurant closures and changes they're trying to keep up. Many of our restaurants, especially in the Portland area, had considered takeout and delivery even before the governor's executive order. And so this list has those that are doing that, as well as those that are just simply outright closing. Next slide, please.
Regarding the economic impact on hotels to date, we obviously are seeing a significant decline in occupancy. Many hotels around Oregon are already experiencing single-digit occupancy. Typical occupancy for a hotel would be somewhere in the range of 60 to 80%. So single digit obviously has a significant impact on paychecks and on the overall system within the hospitality industry. The hotel industry is facing an abrupt and unprecedented drop. There is nothing in our history, including the 2008 recession and 9/11, that even comes close to what we are already seeing. So the updates from the Oregon Health Authority and everything that's happening with our crucial first responders and our healthcare workers, and the fact that we haven't even reached our peak and we're still working to flatten the curve, tells us that there is much more to come. We really have to prepare, I think, on 2 fronts as it relates to this. So I just want to emphasize this again as well. Not only are we going to have a run on the healthcare system, we're going to have a run on the employment department. So whatever we can do to devote resources from a state government standpoint to both our healthcare system and our employment department will be absolutely crucial in the coming days. Next slide, please.
So again, these are some stories direct from our members that we're hearing. In Bend, one hotel lost $600,000 in business in 1 week. They're looking at having to lay off employees because of that loss of business. And it's not just in this current situation, but there are cancellations for events going out months. This is not something that when the ban is lifted, things will return to normal. We're looking at the recovery period being as long or longer than the current crisis that we're in. For some of our coastal properties, we had a hotelier that contacted us and said that talking with local bankers, several of the smaller owner-operated hotels are already seeking financial help and payment relief. Probably going to continue and worsen over the coming weeks, and since much of the lodging on the Oregon coast falls into the owner-operated category, they're imagining that anything beyond 8 weeks will result in permanently closing or forcing sales of some of those properties. Specifically for one hotel in the Portland area, these are the estimated economic impacts, and I'm not going to go through all those, but I'll just jump down to the last one. But they're estimating that in March, their revenue is going to be down 66% from last year, and in April, it will be down 75% based on the cancellations and the lack of bookings at this point. They also noted that they are likely to be laying off 77% of their staff, putting them on temporary leave before this week is over. Next slide, please.
Other stories we are picking up want to really focus in on. For example, anonymously, one hotel group reported that 4 hotels saw revenue decline of $1.7 million in the last 10 days. The closures of restaurants within properties within those hotels are also triggering cancellations across. So a number of hotel companies have had to lay off a few hundred people. I would say that's on the low end at this point. Greg shared some stats with you about other employers in our industry and the layoffs that have already occurred. We have a lot of concern about the ability for the employees we care deeply about getting the insurance they need as soon as possible. And whatever we can do to assist and partner with state government and our local elected leaders, we want to do to make that happen. These are numbers that we have received from our friends at Travel Portland just to showcase where we currently stand. So for Portland, the estimates are a loss of $67 million for business that Travel Portland books directly. Regarding citywide and single hotels, they will have a number in addition to that above. They're still working on that. Not everything. So I do want to make sure that we get that out there. 60% have either canceled or are giving it consideration. 20 conventions have canceled their trips to Portland, and Travel Portland is estimating right now that we're looking at a 75% projected revenue loss for their organization. I think it's really important at this point to remember this might seem counterintuitive, but as it relates to local lodging taxes, we have to make sure in every instance that we're protecting our friends that work in this industry that are marketing the hotels and restaurants throughout our state. When we come out of this, we have to make sure the marketing arms are ready to go. It's our opportunity to win the business when we get through the short-term crisis. If we don't think that way, if we don't think counterintuitively about the importance of protecting marketing dollars, this situation is going to last much longer. So whatever we can do to make sure they have the resources, the reserves, so that they are ready to go when we're ready for people to get back out there, the better off Oregon and our people will be. Next slide, please. So the next one here is a visual. I'm a very visual person, and I just wanted to showcase the reality of what we're seeing relating to coronavirus. It's a preliminary scenario. Our friends at the American Hotel and Lodging Association have assisted us with this data collection. But you can see, as I referenced before, and also in our national press releases, that the impact of coronavirus is bigger than the recession of 2008 and 9/11 combined. This is uncharted territory, and we will come out of it. But in the short term, we have to really figure out how we work together and execute, meet deadlines, and take action steps that help Oregonians and help the small businesses that are calling us in hundreds. I mean, we're getting hundreds of volumes of calls right now and fielding calls with people crying, not knowing what to do. And so we're doing our best to be there to encourage and counsel. But frankly, as an association, we're not really trained for that. We need to make sure that we do whatever we can to connect the hundreds of people that are calling us that are pleading for help and are desperate with the resources they need as we deal with this crisis on the front lines with our crucial healthcare providers. Next slide, please.
So to complement what Jason was just saying about the devastation as far as the hotel side goes, we just received information today. There's an Oxford economics study. So for Oregon, they're estimating a loss of over 30,000 jobs that are directly related to the hospitality industry. the hotel industry in specific, and then the total impact on hospitality jobs, which would include anyone directly or indirectly, is a loss of 114,000 jobs. That's just in Oregon. On this slide, we're starting with the relief needs that we need from the state of Oregon in priority order. The first being we need to take care of those workers that Jason has talked about. We need to make sure that the unemployment insurance is available to prioritize the stability and accessibility of the unemployment insurance fund. So we would ask that you consider transferring the 2019 corporate kicker to the unemployment insurance fund to create immediate access for workers displaced by business closures and slowdowns, to eliminate the job search requirements for unemployment insurance, as well as the 1-week waiting periods for benefits, and lift the requirement that employees be employed for 6 months with the work share benefit eligibility. Next slide, please.
Other important tax-related efforts are on this list. And again, I want to thank Sandy McDonough with Oregon Business and Industry. It goes without saying that the business community as a whole is coordinated, and we feel it's crucial that we stick together, both with state government, employee and labor representatives, as well as business groups, to find a path forward. I think there's going to be a lot of common ground as we figure out how to push through this. Anything that's good for small businesses coming back to life after the short-term crisis is good for the workers. So finding ways to unify and work together are going to be crucial. You heard many times, cash flow is the issue. Recognizing the cash flow crisis facing businesses is something we have to address immediately. One of the ways we can do that is delaying the implementation of the new corporate activity tax. You heard Sandy talk about a first quarter delay with consideration for a second quarter. We are proposing, based on the unprecedented data that we're collecting and the statistics we're seeing, there is no way we can move forward with that until January of 2021. We're also wanting to work with our local governments to put on hold any new tax measures, pending resolution, or anything else related to the crisis, so we can work with our local business communities to free up cash flow, get it to people on the payroll, and at least have a modest approach to sustaining our businesses. If there's any option to suspend payroll taxes for small businesses, that effort could trigger long-term sustainability for state coffers and local governments. If anything keeps us in the way of getting businesses back on track, then that's long-term impact not just for our industry, but also for revenue generated by the state and for our local partners. If we can create a tax credit for restaurant and lodging operations, along with other facilities within our broader industry, it would be great. We've had a number of canceled events. You'll continue to see certain lodging operations make the choice to close their doors for a temporary amount of period. We've already had a few lodging operations do that, in addition to the governor's executive order relating to restaurants. There's a lot of group canceled events out there already, and that's just going to increase. Any tax credit relief, based on the fact that that cash flow is moving from those lodging and restaurant operations back to those customers, could make a big difference as well in getting payroll to employees. So just in conclusion here on this slide, any incentives, tax credits, investments, and job retention, these are the ideas that, in partnership with others on the Governor's Economic Advisory Council, I think we have to collectively continue to discuss. She's mentioned it before, and I completely agree. Innovation is going to be key. Anything that we thought was how we did business in the past really has to be wiped clean. It's a clean slate, and we have to work together to figure out the most innovative approach for Oregonians. And we've always had an Oregon way of doing things, so let's continue being representative of each other and respectful of each other and find that path forward as Oregon always does. Last but not least on here too, extending tax filing deadlines. Just want to make sure that's crucial as well for us. Next slide.
So in order to help facilitate job protection and business continuity, we're asking for the following. Relax the predictive scheduling requirements and enact a moratorium on penalties. As Jason has mentioned, during this unprecedented time, it's just nearly impossible to be able to figure out how to schedule something, how to schedule an employee based on the unknown quantity of customers that may come for takeout and delivery, and with the shutdown that we're currently in. We also would want to make sure that we protect employers from the increased rates and penalties when employees make claims for unemployment due to reduced hours or business closures. We'd ask that you consider providing commercial rent relief and place a moratorium on commercial evictions after March 15th, 2020 for the duration of the administrative action. For the commercial rent relief, a few suggestions might be that any missed payments may be added to the end of the leases. As has been mentioned before, we want to make sure that anything that we're doing at one stage of this it's on utilities and other bills. Next slide, please.
Some other important things that should be under consideration to, again, protect jobs and do whatever we can to reduce the run on the employment department. If we can provide employers with a 60-day extension of time to file their state payroll reports, that could go a long way in making sure they have the cash they need to keep as many people on their payrolls as possible during this time. If we can defer all city and state business licensing fees for 3 months, that would also go a long way. Other opportunities here, deferring payment of quarterly business taxes, which are coming up due April 30th. If we can defer them 9 months to February 2021 with no interest or penalties, that would make a huge difference. And last but not least, 90-day deferral of payment of real property taxes for hotels specifically while they recover. Next slide.
A lot of demand right now for grocery stores because of the fact that restaurants are not able to do dine-in service. So we would ask that any consideration of a complete ban on restaurants not go forward, because those restaurant kitchens, if they remain open, can help alleviate the strain and the increased demand on grocery stores by offering takeout and or delivery service.
I just want to add something here too. In these formats, I want to make sure that we're thinking about restaurants as part of the solution as we move through this crisis. Let's think visually here, create pictures in our mind. The way in which we're going to be engaging customers in the restaurant industry based on the governor's executive order is less human interaction than what we may see in grocery stores. So if we're really looking at making sure that we're keeping the curve down and flattening the curve, making sure that we remember that the new model for the short term for restaurants and amplifying takeout and delivery services is a reduced human in policy that I think we all need to embrace. We, of course, support our grocery stores and the association and appreciate Joe Gilliam and everything he does, and we consider ourselves partners with him. They are absolutely crucial in this ongoing fight we have against the coronavirus. One of the things that I do want to make sure we know and learn from, we missed a real huge opportunity to get food to Oregonians who needed it. We didn't have enough time to scale down and make sure that the restaurant industry out there, 10,000 locations, could take perishable food and get it to people that were in need. A lot of our folks did get food to their employees, and they were able to take that home. But I think you all know that the executive order went into effect at 5 p.m. yesterday. We found out about that the day before. And again, moving forward together in a positive fashion, collectively, is what we care about. I just want to make sure that we learn from that mistake, because there is a lot of food loss as a result of not having a scaled down period. Perishable food got to people who could use it. So that's really crucial. Insurance policies was brought up earlier, and we've talked to a number of insurance agents over the last 72 hours. Many believe that this falls into a gray area and it is not covered. So we're going to need the governor's help. We're going to need the state legislature's help to make sure that property and casualty insurance policies cover this gray area, which is the coronavirus. And that is, I believe, to Sandy's point, going to be something we're going to have to work on in the coming months together.
So finally on this slide, Jason mentioned a grant program earlier. We're looking at a grant program for hospitality businesses who have seen sales decreases of 25% or more in order to help them get back on their feet, continue to pay their employees when they're able to hire them back, and make sure they can be successful.
One final thing on insurance policies, I'm just going to make a statement here because it's reflective of the notes and information we've been getting from so many of our members. So I'm just going to read it very plainly. COVID-19 must be included in the triggers that allow restaurants to make claims. Next slide, please.
Our last two suggestions are to allow for alcohol, which would include mixed drinks, beer, wine, bottles of distilled spirits, to be sold as a to-go or delivery item or to be picked up curbside. Other states are looking at this and doing it. It's one of those ways in which restaurants in their limited capacity now, without being able to do dine-in, would be able to actually bring in revenue to help pay the folks that they are able to still employ. So we'd like to look at that. There was a bill that was going to look at alcohol delivery this last legislative session, and so we can work on building on that to make sure that we allow for those sales to go through. And then finally, making sure that we create a statewide preemption to allow curbside pickup for all restaurant takeout and to-go orders. We are asking that there be no barriers or obstacles to restaurants in this limited capacity to be able to sell and offer their products to the consumers out there that want to continue to support us. Next slide, please.
As we wrap up here, we just want to focus in on communication because none of the things that we've had an opportunity to share with everyone here on this line will happen without over-communication and a commitment to constant communication. So number one, establishing regular lines between business and Oregon leaders to have those regular updates and strategy discussions on a sector-by-sector basis. I want to thank our friends Christian and Leah in the governor's office. Their leadership has been great and is going to be crucial for us in making sure that this sector-by-sector response team strategy goes into effect as soon as possible. Number two, create a small business crisis line so we can triage calls. You've already heard that. Both for employers and also for employees. I would consider maybe two separate lines, one for small businesses and one for employees who are dealing with layoffs. Number three, require state agencies, including the Oregon Health Authority, BOLI, Employment, Transportation, Lottery, Revenue, and the Secretary of State's office to create designated resource sites for employers. I heard from a few people through text messages while we've been speaking that I might have been a little patchy at the beginning of the presentation. So last slide here is our contact information. Just to reiterate, my name is Jason Brandt, and I'm the President and CEO for the Oregon Restaurant and Lodging Association. And I was joined today in our presentation by Greg Astley, our Director of Government Affairs. Our contact information to keep a commitment to over-communication is right there. And we, of course, would welcome any questions. And again, want to thank Chairs Holvey and Roblin for the opportunity, as well as all of the committee members, to share real-time data and solutions that we think can help all of us get through the current crisis. Thank you so much.
Thank you both for your presentation. It's definitely eye-opening, and one of your last bullets, I hope that the governor's office, I think they are moving towards that sector-by-sector response team. I think that's something that is going to be critical to address business challenges across the state. So I appreciate you having that on your slide. I don't know if there's any questions, Senator Boquist.
I just want to thank you for your presentation, but tell members, and Greg has got this, I sent it to him last night and sent it to staff, and of course everybody's busy. So later today, going up online is an email from Legislative Revenue Office that outlines the economic impact in payroll to the retail and hospitality sector, which tops $1 billion per month in payroll. And so the UI account's going to get hit pretty hard here. So that data is coming up for members to look on. And then Josh Lerner has put some data in too in regards to the Office of Economic Development or economic analysis in terms, again, of lottery and retail sales. So members will look and see that data that supports what they're saying from our own staff at LRO.
All right. Thank you very much. I need to move ahead on the agenda or way over my time. I apologize for that, but I feel the just this information so extremely important in these trying times. So I'd like to skip ahead to John L. Bell. If you're on the line, the floor is yours.
Great. Can you hear me okay, everyone?
So far, so good.
Okay. Well, thank you, co-chairs Roblin and Hovey and members of the Joint Committee. My name is John L. Bell, and I am the president and founder of Espousal Strategies, which is a small business here in Portland. I am also a member of the National Small Business Association Leadership Council, the nation's oldest small business advocacy organization, representing over 65,000 small businesses nationally. During the heart of one of our nation's most difficult periods in World War II, President Roosevelt stated the following. He stated, "The point in history at which we stand is full of promise and danger. The world will either move forward toward unity and widely shared prosperity, or it will move apart." Members of the committee, we find ourselves at the fork in the road once more. The widespread COVID-19 pandemic, in just a few short weeks, has crippled the society and communities throughout our state. Small businesses who were thriving and experiencing some of the greatest economic prosperity in recent history are now having to make the very difficult decision to close their doors. Oregon has always been fueled by the hardworking women and men of the small business community. These leaders hire people from our communities, invest in our schools and nonprofits, and are beacons of hope. Simply put, our ability to come out of this stronger than before rests squarely on how we collectively come up with solutions to help small businesses. These are sole proprietors, independent contractors, barbers and hairdressers, and those with 1 to 50 or 50 to 100 employees survive during this unprecedented time. To this end, I encourage the committee to make priority the following recommendations. Establish an immediate moratorium on commercial evictions and commercial rent payments. Institute payroll tax relief or holiday to put much needed money into the pockets of both small businesses and their customers. Further, extend the 2020 tax filing deadline and postpone quarterly payroll tax payments and institute a moratorium on penalties and fees. Create and fund an emergency small business relief fund that provides direct financial assistance to help businesses meet payroll obligations, fix expenses, and maintain their supply chains and inventory. These loans and grants need to be easy to apply for and have low interest rates with realistic payback terms. Now is not the time for more red tape. They also need to be available in critical languages like Spanish. Supplement the Governor's Strategic Reserve Fund with additional resources for one-time grants to businesses impacted by this pandemic. Create tax credits to incent small businesses to retain their employees and help their employees pay for child care. Make sure that construction is considered an essential service. We need to keep these contractors and the workers they employ working, while of course we employ strategies like social distancing to keep workers safe. Encourage government partners. Local, regional, and state governments should avoid freezing contracts with small business vendors and prioritize opportunities to support small businesses through procurement. Require all state agencies to promptly pay invoices of small firms, and especially minority women and emerging small business firms with 50 or less employees within 30 days. Currently, many state agencies take up to 90 days to pay contractors for work performed. Now more than ever, small businesses need to be paid promptly to maintain critical cash flow. And finally, a significant economic stimulus needs to be crafted and ready here in Oregon. We need to be concerned about flattening the curve on economic destruction. In closing, the time now calls for big action to address the truly vast and acute needs of the thousands of small businesses that have been impacted. It needs to be simple, with a minimum of paperwork and red tape to ensure businesses with limited administrative capacity can access them quickly. And this aid must come in the form of direct assistance to small and medium businesses and their employees. Our collective goal must be to keep these businesses solvent. Thank you, and I'll take any questions that may arise.
Thank you very much. Questions? I appreciate you being here and giving us your presentation on small business. It's really important that we keep a real small business in mind as we go through this. It's trying times for all of us. Thank you, Mr. Bell.
Thank you.
Up next, Anthony Smith.
Can you hear me okay, Mr. Chair?
Yes, we can.
Perfect. Co-chairs Holvey and Roblin and members of the committee. For the record, my name is Anthony Smith. I'm the Oregon State Director for NFIB, the National Federation of Independent Business, representing thousands of small businesses across the state, many being the smallest of small businesses. And please keep in mind that NFIB represents small businesses in every industry sector. And although 90% of our members have fewer than 25 employees and 70% have fewer than 10 employees, the small businesses we represent account for over 60,000 Oregon jobs. I want to start off by thanking you for the invitation to testify today, and I really, really appreciate all the comments during this committee hearing thus far from everyone, legislators, the governor's office, and my fellow panelists. My goal for the day in today's testimony is to share with you what we know so far about how the coronavirus is impacting NFIB small business members nationally, how our organization is responding to proposed federal actions, and I'd also like to share a few stories from our members in Oregon to illustrate what they've been dealing with over the past few days and weeks. First off, this past Friday, March 13th, the NFIB Research Center released data collected from our members on March 10th and 11th on the impact coronavirus has had on small businesses. Just to be clear, this data is now a full week old before many jurisdictions across the country implemented new policies and guidelines for businesses and the public at large, including here in Oregon, where the impacts are likely more severe. But it is a snapshot in time that can help serve as a baseline as we move forward. The survey found that while nationally most small businesses were not yet experiencing direct impacts, owners were very concerned about future disruptions if the outbreak continues to escalate, which it definitely has in the week that has passed since the survey was conducted. And while a majority of small businesses were not yet reporting those direct impacts from the corona outbreak as of a week ago, the outbreak was still already negatively impacting already 23% of small businesses. Of those small businesses who are not yet experiencing disruptions, 43% anticipated their business being impacted if the coronavirus outbreak spreads to or spreads more broadly in their immediate area over the next 3 months. 20% did not expect to be impacted if the outbreak spreads, and another 37% were unsure. So there's still a lot of questions, and people are still trying to figure out if this is going to affect them and how it's going to affect them. Of the businesses that are already experiencing negative impacts, 39% were already experiencing supply chain disruptions, 42% slower sales, and 4% had sick employees. And of note of that 4%, the 4% of owners citing sick employees likely responded this way out of heightened concern and precaution with sick employees showing some signs of cold or flu-like symptoms, but it's not necessarily because they have employees who have had tested positive for the virus. So I think it's important to note that. Whether impacted or not, already many small businesses are taking measurable steps to prepare their business for the coronavirus. 30% of owners told us that they have stocked up on disinfectant and hand sanitizer for their business, and 12% had already talked with employees about sick leave or work from home policies. Just 3% had modified their supply chain or changed their buyers or vendors. And additional comments we received included owners taking action by talking with employees about helpful prevention practices such as frequent hand washing and ordering supplies and inventory ahead of schedule. The level of concern among small business owners about the coronavirus impacting their business varies greatly in these initial weeks of the outbreak. As of the time of the survey, about 44% of small businesses were somewhat or very concerned about its potential impact on their business, and another 37% were slightly concerned, and just 18% reported that they were not yet concerned. All of these numbers have undoubtedly moved significantly in the week that has passed since the survey was conducted. I've not heard yet from the NFIB Research Center when they will deploy another survey, but these results will be posted at our website at nfib.com/coronavirus. And anyone interested in tracking the impacts of coronavirus on our members is welcome to use this website, not just NFIB members. Again, that web address is nfib.com/coronavirus. There you'll find everything we have available at this point, including a webinar that was held last Friday, another scheduled for this coming Friday, many legal resources, and updates on federal actions being considered by the President's administration and the United States Congress, which brings me to my next subject. So what is Congress doing and how will it affect small businesses? In response to the coronavirus pandemic, Congress has been moving pretty quickly for them. NFIB has been in communication with both the administration and Congress about ways to address the impacts to businesses, employees, and consumers, but without adding detrimental burdens small businesses cannot sustain. As I've mentioned previously, we will provide updates at nfib.com/coronavirus with all the latest information and what it means for small business. With the coronavirus crisis picking up speed, Congress is on the verge of enacting significant new mandates on small business. In fact, while we've been here watching this hearing, I got a news update that the Senate has passed the House bill that I'm going to be talking about right now. Very late last Friday night, the House of Representatives passed the Families First Coronavirus Response Act. It's intended as a measure to help workers. The bill requires all small businesses to provide employees with 10 days of fully paid sick leave. It further requires all small businesses to provide up to 12 weeks of paid family leave at 2/3 of regular pay. The bill applies to all companies with actually fewer than 500 employees. You heard me right. It applies to companies with fewer than 500 employees. Larger businesses are exempted from these paid leave requirements. NFIB, representing small businesses, we came out in opposition to H.R. 6021 prior to its passage in the House because this legislation, in our estimate, would limit flexibility in adjusting to a rapidly changing environment and impose potentially unsustainable mandates on small business. NFIB's letter to Speaker Pelosi and Minority Leader McCarthy can be found at the website. I'll say it again, nfib.com/coronavirus. The bill's provisions mark a dramatic expansion of the Family Medical Leave Act, which includes significant paperwork requirements. Small businesses would have a matter of days to familiarize themselves with the law's many regulations. In an attempt to help small businesses cope with these burdens, the bill does provide a 100% tax credit for the cost of its paid sick and family leave mandates. Companies can claim this credit through their payroll tax filings, but this process is still yet to be determined. The bill gives the Secretary of Labor the authority to waive the new leave requirements if it jeopardizes a company's viability. However, only businesses with fewer than employees would be eligible, and it's still unclear how that would apply or the process the Department of Labor would use to evaluate waiver requests. And while we appreciate Congress's desire to provide relief from these new regulations, the timing will still create something that you've heard all day today, a major cash flow crisis for small businesses, those that are already struggling with lower revenues or even in some cases no revenues. And they need relief now, not when it's too late. So currently, our federal team at NFIB is in conversations with the Senate and the administration about improving the federal legislation. That being said, this House bill is unworkable for our members. By requiring small businesses to shoulder additional burdens and costs, small businesses who can't afford to keep up will close. The coronavirus is doing enough damage without policymakers unintentionally adding to the list of problems facing small businesses, which is why, as of yesterday, over 100 business organizations have joined NFIB on a letter to Senate Majority Leader McConnell and Democratic Leader Schumer, urging the Senate to take a different approach than the House on paid leave policy specifically. One example is the proposed program in H.R. 6198, which the federal government would provide the necessary resources for the Social Security Administration to provide financial assistance to American workers impacted by COVID-19 related leave needs. The coalition suggested improvements would ensure all American workers have access to paid leave in the face of this public health crisis, while also providing relief to businesses and important incentives to sustain access to employer-provided health benefits on which nearly 180 million Americans depend. I think, I'm still trying personally to get up to speed on the federal bill that, as I said, looks like it has passed the Senate. But what I can tell you, as someone who is here in Oregon and familiar with our Oregon legislative process, is that the federal proposal differs very significantly from the Oregon Family and Medical Leave Act that was passed by the legislature last year. That program that we passed in Oregon set up a new family and medical leave insurance program that would be administered. People would apply and it would be administered by the state. That is not how the federal program works. To kind of paraphrase how it works, the small businesses, again, fewer than 500 employees, would essentially be fronting the money that the federal government has allocated by continuing to pay their employees directly while they take this extended leave. And the problem there, it's not for lack of wanting to pay while their employees are out on this extended leave. It's a matter of cash flow, as I said before. If you have zero to little revenue coming through the door, and you're still responsible for meeting your payroll in addition to any employees who, through no fault of their own, are needing to take this benefit, then you're going to run out of money real quick. And so that's our concern, and that's why we've put forward an alternative that we're hoping that Congress will consider in the coming days. Lastly, I want to just touch briefly on some of the member experiences that I've come across over the last couple days and the weeks. I've been on the phone with NFIB members almost nonstop for the last few days, and for the most part, the overwhelming sentiment that they've expressed to me is extreme worry. They don't know how they're going to get through this. There's a lot of fear, anxiety, and on top of all of that, a very large percentage of our members fall into the age category where they should really be staying home to limit their exposure to the virus, but they can't do that. Their business depends on them showing up, and so do their employees. One of our members owns several retail shops. He primarily sells greeting cards and gifts. In his words, quote, "Things are looking pretty bleak for small retail. Sales are down significantly. Starting today, he's reducing the hours that his stores are open and cutting staff hours by half." He tells me that March and April are already his slowest months of the year, so he's extremely concerned that his business is not going to make it. Cash flow, again, absolutely critical. He's already applied for an SBA loan, but hasn't heard back yet. He's still showing up to work every day because he has to, even though he's over 60 years old. Another one of our members is a plumbing contractor. Work hasn't slowed down for them yet, but he's already heard from some of his customers that they aren't going to be able to pay their outstanding account balances. His plumbing business does a lot of work for restaurants, fitness centers, and care facilities, all of which are experiencing their own challenges at the moment. He's having trouble accessing the equipment he needs to keep the business going, including masks and gloves. And bottom line for him is he has debts to pay and a payroll to meet, and he's not sure how long he can last if his customers can't pay him. Another member of ours owns a small winery. She has a handful of employees and a significant number of fixed costs, but as of right now, the business is effectively shut down. She's considered a loan, but worries that she won't be able to pay it back. She's doing her best to keep employees working so that they continue to earn a paycheck, but in her words, this could be the end for us. Wrapping up, I'd like to echo many of the good suggestions from our friends at OBI and Orla and Mr. Bell's organization as well. My counterparts, that being said, I won't go through all of the suggestions that you've already heard in the interest of time, but just know that my counterparts and I across the country, state directors for NFIB, are compiling a list of state-by-state legislation, executive orders, proclamations, and best practices that we hope to be able to share at some point soon with elected leaders. But for now, my advice is to just talk to each other and really listen to each other. This body is made up of 90 legislators with diverse life experiences, and appropriately, several small business owners serve on this very committee. And so we're committed to looking for solutions together and to make it a point to minimize unintended consequences whenever possible, which is, I know, especially challenging during a situation like this where there's a tremendous need to act swiftly and decisively. That concludes my remarks, but I'd be happy to answer any questions if you have any. And again, thank you very, very much for the opportunity to testify today.
Thank you, Anthony. I appreciate you being here and waiting around and going through all this. This is really important stuff, as you know, and sincerely look forward to your updates as you get it from your industry group. Really important to hear from you. So thank you for that. Senator Boquist.
Thank you, Chair. And I don't want Anthony to answer the question, but I'm just an observation from my colleagues here because I'm looking at another business owner over here. It seems to me at the state level, one of the impacts is going to be is as the federal government has done this, it won't take effect under the law, having read for 15 to 20 days. It's going to accelerate the unemployment ratio in the state of Oregon because small businesses that can't weather it are going to lay people off. And as we just heard from the Restaurants Association, one option is trying to weather it. And this is likely to them to say, okay, state, it's in your ballpark because we're going to have to lay these people off because we can't survive. And so we could see a huge rush on our UI system.
Yep.
That's a really interesting point, Brian.
Which has been pointed out is not an unlimited pool. I appreciate the comments. We have a lot of information to get through and triage and prepare for our next meeting. But Anthony, thank you again. Our last presenter, Allison McIntosh.
Yes, can you hear me, Chair Hovey?
Yes, we can.
Great. Co-Chair Roblin, Co-Chair Hovey, members of the committee, thank you so much for having me here today. For the record, my name is Allison McIntosh, and I'm here today on behalf of the Oregon Housing Alliance. I really want to appreciate and thank you all for holding this hearing, and I am going to focus my remarks on housing stability, homelessness, and food security. As you know, the Housing Alliance is a coalition of 90 organizations from all parts of the state. We represent a diverse set of voices, including nonprofit housing developers, residents of affordable housing, local jurisdictions, and organizations that are working to meet basic needs in every corner of our state. We believe
believe that all Oregonians need a safe, stable, and affordable place to call home. And we are here today to request that the legislature take bold and swift action to provide immediate assistance to Oregonians who are likely to be impacted by the coronavirus, both directly and indirectly as a result of the loss of income and wages. I will say that what I'm going to share with you today are my current thoughts, which, as I'm sure you all know, are rapidly evolving based on what we know and the dramatic changes we've seen over the last 7 days in response to the coronavirus. Prior to the coronavirus, you all know that Oregon was facing a housing emergency. 3 out of 4 households with extremely low incomes were paying over half of their income towards rent. And when people pay a significant portion of their income towards rent, it means that they have too little money left over for food, medicine, utilities, or other emergencies. And an emergency like this may mean that they end up experiencing homelessness. With businesses shutting down and people being laid off, the lack of income and economic instability will have severe and negative impacts on people's housing stability. I want to echo Graham and Melissa's comments from earlier that these impacts are much worse for people with low incomes and communities of color. We need urgent action from the legislature to mitigate these impacts. The Housing Alliance believes that the legislature should take immediate action to stabilize people in their homes and to help those currently without a place to live. And I will talk in a little bit more detail about what we are currently thinking about. So first, immediate rent assistance and eviction prevention. We are urging the legislature to enact a statewide moratorium on evictions for the non-payment of rent and a suspension of late fees. During these times, we need to do everything we can to provide Oregonians with safe, stable places to call home. The majority of tenants who have lost income already due to the virus are already facing difficult choices about whether to purchase food for themselves and their families or whether to try to save limited resources for an April 1st rent payment. Action from the legislature is necessary to maintain housing stability, to keep people home from work if they're sick, and to protect public health. We are deeply concerned about economic evictions beginning in early April due to the loss of wages and other economic impacts, and we ask that the legislature immediately issue a moratorium on evictions to keep people in their homes. I want to reiterate that while April 1st may seem a long ways off, given how rapidly the last week has changed, for people who are currently at home without income or are currently being laid off because their work is shutting down, they are worried today about being able to make rent payments in April. They are making choices today about what food to put on the table, what supplies to buy, what utility bills to pay, because they are worried about that April 1st rent payment. And we would urge you to act immediately and issue a moratorium on evictions to keep people in their homes. In addition, it will be necessary to help landlords of all types to pay the mortgages on their rental properties and to help homeowners avoid foreclosure. The legislature should make significant amounts of emergency rent assistance available to people who are being negatively impacted by the coronavirus. We will need significant amounts of rent assistance for people who are economically impacted by this virus, including through our existing delivery systems through the community action agencies, and we may also need to consider a broader, more significant provision of rent assistance. I also want to highlight that a moratorium on evictions and a suspension of late fees assumes that people who rent their homes will be expected to pay that rent back to landlords once they're back at work and the moratorium is over. Portland's moratorium has set in place a requirement for payment plans. And I just want to highlight and make sure that you all understand that many tenants who work low-wage jobs may not be able to repay 1 or several months of rent, and rent assistance provided by the state will be really critical. Second, I want to talk about the urgent assistance needed to affordable housing providers. We will need direct assistance to affordable housing providers to support the regulated affordable housing units across the state. In Oregon, the vast majority of our regulated affordable housing has been built using federal tax credits. These resources do not allow housing providers to decrease or waive rent payments as a result of income losses for tenants. And for the vast majority of buildings, the federal government only provides initial construction resources. Providers of regulated affordable housing are working very hard to ensure that they will not evict tenants due to the non-payment of rent because of the coronavirus, and they will need financial support from the state. Financial resources will help ensure the housing stability of tenants and give providers the ability to waive unpaid rent accrued as a result of the of economic impacts of the pandemic. It will maintain tenant stability and allow essential operations to continue. Because of the regulatory structure in place through Oregon Housing and Community Services, we would suggest that providing direct assistance to affordable housing providers whose tenants can document economic losses due to the pandemic may be the most expeditious path forward, and we're working to further develop this plan. I will also add that there's news today, while you all have been meeting, that the President is directing the U.S. Department of Housing and Urban Development
is now exiting.
To suspend evictions and foreclosures on FHA mortgages, Fannie Mae and Freddie Mac. We have just seen this guidance and we don't yet have details, but we will be looking into it. Aside from providing stability for current renters who may be faced with eviction or homelessness due to lost wages, we must also provide immediate resources to respond and help those who are currently experiencing homelessness. Oregon has one of the highest rates of people experiencing unsheltered homelessness, meaning that they are sleeping outside in a tent or a car. A 2019 study found that Oregon is one of 4 states where more than half of people experiencing homelessness don't have access to shelter. And here in Oregon, 61% of people experiencing homelessness are unsheltered. And this is directly due to the lack of available shelter in our community. People experiencing homelessness are our neighbors and members of our community, and we need to act to support them through this crisis. They are also already often experiencing negative health impacts of sleeping outside or experiencing other underlying medical conditions and are at high risk of being extremely sick due to the coronavirus. They also have limited resources to help them implement the recommended guidance about hand washing and self-isolation when they're sick. There's a few things I want to highlight that we think the legislature should do. First, we need to continue to provide emergency shelter. In normal years, winter shelters would close in March as temperatures rise. We need to continue to provide emergency shelter for people who don't have a safe place to call home, and that will require additional resources. Second, we need to increase resources to provide access to motels, to provide shelter to people at high risk of severe illness or people who are already experiencing illness. Motels offer an opportunity to isolate people at high risk or to provide a safe place for people to be isolated who are already sick. We will need increased resources for that purpose. We will also need increased shelter capacity. The current guidance from the CDC suggests that people be kept 6 feet apart. We would need to increase shelter resources to expand locations in order to maintain these distances or to reduce the number of people currently in shelter because our current shelters are not configured to maintain that distance. Shelter staff need increased resources. In many communities, unfortunately, shelters rely on volunteers, many of whom are over 60 and are now being asked to stay home. That means shelters are without volunteers and they need to hire staff or increase salaries for current shelter staff. Organizations providing street outreach or supporting vulnerable people in housing at this time will also need increased resources in order to safely protect themselves and the people they serve while maintaining people's housing stability. Shelters may also need resources to fund hygiene, such as hand washing stations, hand sanitizer, soap, and other critical supplies. Lastly, for people experiencing homelessness, I would say camp sweeps can be very dangerous and disruptive in the best of times. During this time, they may unintentionally move someone who is experiencing coronavirus to either another part of town or to another camp. ODOT and cities should increase sanitation, provide additional hand washing stations, and really severely limit or prohibit sweeping camps immediately. I want to switch gears and discuss food security for a moment. As you all know, food and housing costs are very directly linked. Food is one area of a family's budget where they may be able to make choices in difficult times, and far too many Oregonians are familiar with extremely tough choices between paying rent or food. I would highlight for you all several letters included on the record that highlight in detail some important choices that need to be made by either the state or the legislature to ensure people have healthy food available to them at at this time, including a letter from Partners for a Hunger-Free Oregon and the Oregon Law Center. I want to highlight a few of the steps they outline. First, DHS should be exercising each and every option at their disposal to ensure more Oregonians have access to the Supplemental Nutrition Assistance Program, or SNAP. SNAP is a 100% federally funded, critical, and flexible source that can help families access food through the grocery store. That people can access benefits quickly as their income drops or they lose their job. Oregon should request every option under the new federal SNAP pandemic planning guidelines and eliminate all regulatory barriers to food access. People should not have to go to an in-person interview with DHS to access SNAP benefits, nor should they go to an in-person hearing to maintain access to food. DHS should prioritize making income changes immediately to ensure people who have lost income don't wait for additional food benefits. Oregon should also increase their outreach during this time, particularly for non-English speaking people. Clear, compassionate information spread widely on the internet or by phone about how to apply will be critical. And we should prepare for hundreds of thousands of Oregonians needing SNAP benefits in the coming weeks and months due to income disruption and plan to process applications as quickly as possible. Oregon should anticipate and immediately implement plans currently pending in Congress to support families accessing additional food benefits because of disruption to schools. And we should encourage grocers to participate in grocery delivery programs through SNAP to protect people who are seniors and people with underlying health risks. As a note, I would also add we're concerned about people who normally would have food delivered through a social service program, a housing provider, or Meals on Wheels. Those are being severely impacted at this time. Oregon should be doing everything we can to support people accessing public benefit systems such as SNAP, temporary assistance for needy families, and our health plan during this time to prevent further harm to communities. And many other pieces of testimony in OLIS can provide details on the specific assistance the state can provide. Lastly, I would note that in the long term, we must continue to address our affordable housing needs by creating more safe, stable, and affordable homes. And to help Oregonians overcome the economic impacts associated with the coronavirus, the legislature should move forward with budget requests put forward during the 2020 session, including money to build and maintain new and existing affordable housing and to expand shelter capacity. The measures and funding that I've outlined today would provide both short-term and long-term relief to Oregonians struggling as a result of the housing crisis that will be significantly worse and impact many more families as a result of this pandemic. Finally, I would just add, I will not go into detail, but we are advocating with the federal government for similar resources, policy changes, and regulatory changes. My letter in OLIS goes into a little bit of detail about those requests, but happy to share more detail with any of you as you need. Thank you so much for your time today and for your service to our state during these challenging times.
Thank you, Allison. Appreciate you wrapping it up with this important piece and part of our charge as well. Are there any questions for Allison? Senator Steiner-Hayward.
Just a quick comment, if I may, Mr. Chair. The point that I think we have to remember is it's less expensive to keep people in their existing housing than to rehouse them once they've lost housing. And it's very important that we also remember that being unhoused contributes to adverse childhood experiences, which has long-term ramifications for children's well-being and their success in schools. So providing housing and helping stabilize housing for people in this state is critically important during this crisis. I can't emphasize enough the number of impacts, adverse impacts. It's hard to apply for a job if you're living out of a car. It's hard to get your homework done if you're living out of a car. It's hard to get your homework done if you're sharing a one-family home or apartment with 2 or 3 other families. So housing really has to be one of the most fundamental things that we focus on during this crisis to make sure that we don't have all of the ripple effects that being unhoused causes.
Yes, it is a big issue that will cost the state even more money if we don't figure out how to address it. I totally agree.
That's exactly my point, yep.
So I appreciate all the comments, committee. That's the end of our testimony. And thank you for enduring this 4.5 hours almost of constant testimony explaining the impacts that we are facing across the state. And I know that the asks that everyone is coming forward with are a lot. And as you all know, we have a balanced budget scenario which with some reserves, but doesn't come close to matching the needs that we've heard this today. And we need to really prioritize what we need to do first strategically, as I think the governor's office actually mentioned at the front end, to be very cooperative and talking to everybody to figure out what we should do first. But it's clear that we do need to act relatively quickly with many of these items. I know we're trying to get another meeting scheduled Friday. I would assume it's probably going to be around 1 o'clock or 2 o'clock, just for the time frame, if we're able to pull it off. I'm not entirely positive we will, but I'm fairly comfortable we'll be able to put some pieces up on Friday that we need to hear from. There's a lot of information that we've received. There's a tremendous amount of information on OLAS. If the committee members could review that information that we didn't have presented to us today, I think that would be helpful in understanding the full scope, and maybe even, think about what your number one or maybe top 2 things that you think we should address first. That might be an impossible task. It sounds easy, but maybe not. But it would be good to get that sort of input from the committee, as Senator Roblin and I are going to be trying to triage all this data information and try to sort it out for our future conversations. It's really obvious that we have a tremendous crisis like we haven't seen before. I think that as Oregonians, we need to work together and really do what we can. It's tough to think that we need to isolate ourselves from other people, but if we are going to really save our economy to some degree, we need to slow down the spread of this virus so that we can actually address it, so it doesn't completely overwhelm the entire economy and all of our services. So I implore everyone to try to stay healthy, look at those guidelines, wash your hands. This coronavirus may not seem like it's affecting you or may not even be present in your area, but everybody needs to practice this social distancing, and if we're going to slow this, I just implore people to take this very, very seriously. If we approach this, I think, practically and strategically, we can be a lot more successful. It's obvious we're not going to be able to stop all the negative impacts. That's just impossible at this point. We need to figure out how to minimize those impacts, and working together, working with the governor's office in that response, and trying to figure out where we should best utilize our resources to first slow down this virus. And we really need to do that first. It will save the economic impacts that we may suffer by some amount, and save some jobs and save some businesses. So I don't want to overwhelm everybody at that, but this is an overwhelming subject matter and we need to tackle it. So I appreciate everybody's input, appreciate y'all being here and helping out and serving the state of Oregon. Senator Roblin.
I'll just say a couple things. One, if you're watching us from home, recognize that individual personal responsibility is the best way to protect yourself. We can do things, but the reality is you can protect yourself by taking care to listen to what the experts are telling us to do and keep yourself out of the way of this virus. So the more people that do that religiously and take care of themselves, the less the problem will be. So we want to really encourage that and to be calm about it and take care of it. We hear about things, and we'll see lots of our texts about hoarding and people running to the grocery stores. We have already acknowledged that those workers in those stores are essential workers. Our system of transport and getting stuff to those grocery stores continues to work. So expect your local grocery stores are going to have product, and you don't need to do the hoarding. So I want to encourage people to think about their behaviors in context of this whole epidemic that's going on. The other thing is, I really would like people to think about the things we've heard today and to look. Last night I read all of because I knew there was going to be an influx today, so I read through everything that was in OLS. It was only like 50 yesterday. It'll be a lot more today. But we have all of our staff here at the Legislative Outro reading those as well, and they will put together a synopsis of what that looks like, what all of those are, and by category, which will be helpful for all of us, and that should be posted at the end of the day as well, we think, on OLS, their recommendations. You as committee members got their first draft of that, hopefully today, so you can look that over. My feeling is that we really need to hunker down and try to get something ready by Friday, and I really appreciate the idea from Senator Boquist about having us all understand what the two experts in our committee know about what it means to have the response that we have right now and how that works, because the more we understand, the better. If you have ideas about something you need to know that this committee has brought up today, please get it a hold to us or to Jan so that we can put that together for something on Friday, because I think it is important for us to continue to have meetings on a regular basis. I think the public is expecting us to do that. They know that we have to be at work. I want to say that I appreciate the fact that we are here as a group. We are representing all Oregonians. That's what we need to continue to remember. We are representing all Oregonians. It's not any one group or another group or whatever. We have to figure out the best case forward, and that's something that's really going to be important. And so really understand. I'm feeling pretty good right now, personally, because I'm distancing myself, I'm doing stuff. I have my wife home and safe. I've got family members all over the country, all of them protecting themselves. You can do the same. And the truth of the matter is, Oregonians in general have repeatedly risen to the level they need to take care of things. And I expect, and have seen it in the committee members that I've talked to personally, they're all rising to that level. I mean, I see people here stepping forward to do the things that we need to do to help protect Oregonians. And I'm excited about being on this committee. I'm excited about the opportunity to work with Oregonians to solve problems. And I anticipate that we will be able to come up with some solutions and get to a special session, get the resources necessary for people to continue and come out the other side, because I think that's equally important. So I appreciate all of your attention. I appreciate the opportunity to serve Oregonians with you in particular, because you're on this committee, but with all of the people who have been texting me all day long and who care, that really care about how we move forward. Thank the executive branch and the governor and all the people that are doing that stuff. We, I think, are anticipating having some talks with some people at 4, and I hope we have some members that will come for press availability that will happen then. So to do some stuff, we're going to try to get together and meet and start planning for what we're going to do on Friday. And I will keep people.
What's that for? What's it for?
At 4, there's a press availability kind of thing for the two of us and a couple other people. I've talked to a few. Not everybody needs to be there. They just wanted to have a chance to talk to a few people, so we'll try to work that out. So with that, I don't have much more to say other than I will continue, and I know that Representative Holby will do that, to individually talk to my members. As you have questions, don't hesitate to call me. I will try to get a hold of every one of you as often as you would like. Text me and I'll make that happen. Because I think keeping us informed and keeping an open communication is singularly the most important thing we do. Plus getting really good information, and I hope that's what I appreciate today. If you don't have the information, you can't move forward. So we have to keep that and keep working together. So I just thank everybody for the opportunity.
Senator Boquist, a comment?
I just have a question for time purposes and time management for all of us. Should we anticipate, given there's 3 broad categories, and we're going to be at this for months, by the way, regardless if it vaporizes, which let's all hope maybe the frost sets in, it goes away. And so
That's
there's
right,
optimism and hope all the time. But are we expecting we should probably be planning to be working in work groups at some point in the future, or just review a plan someone's going to put forward and hand to us on Friday? Help us with our, because we are, of course, cloistered too. And obviously, there's a lot of people who are willing to work. So I'm trying to understand, from your guys' perspective, what we should be doing.
Yeah, I think there's going to be a time for that coming pretty soon, where we will sort of probably break up some subject matters, and not that we're going to exclude anybody from a overall subject matter, just to be more efficient. I don't know that we're quite there at that time. We still have information to gather, and we need to categorize that information as well. And so we'll get back to you on that structure, but I'm sure that we will be doing some of that. Senator Steiner Hayward.
Thank you, Chair Hovey. Senator Boquist's question prompts me to ask about timelines. Obviously, this work is urgent. Equally, obviously, as Senator Boquist said, we're going to be at this for a while. But have the presiding officers or the governor offered any thoughts about, we're going to need to make some statutory changes, and we're definitely going to need to dump a bunch of money into the emergency fund, says the co-chair. I don't know if we've talked about a timeline for a special session. Maybe it's too soon to talk about that, but I think it's important for people to understand that we recognize a sense of urgency, and this is not going to be this is going to be a staged process. We're going to make some decisions up front probably, and have probably a special session to do some really urgent things quickly, and then there's going to be another stage and another stage and another stage. So I don't know if you have any sense yet of what the timeline on those stages the first stage will be, at least, but I think people need to understand that that's how I can't imagine this committee's work playing out in any other way than that.
No, you're absolutely correct, and things are changing rapidly. We're trying to meet at least 2 times a week in this committee in anticipation of having to make some statutory changes and some budgetary movement very soon in a special session. I can't tell you what date that is going to be.
No,
I don't know that
that.
anybody can at this point. As soon as we figure out exactly what our first steps are going to be, you'll see that happen. And even after that, you'll see this committee probably continuing to address some of the longer term economic issues and what is it going to look like 6 months, 1 year from now, those sorts of ideas as well. So it will be an ongoing thing, and it may take more than one special session, but I certainly am not the one that makes that decision. I'm not sure the presiding officers have, and the governor's office have figured out exactly when this needs to happen. I think it'll happen kind of organically when we realize that we're ready. But I know there's urgency about getting resources to where they need to be right now, just for the response, singly, just for that, and then as well as any other recommendations that we feel we can get out of this group that need immediate urgency associated with it. So I think that's some of the triage that we need to go through and figure out. That's why I'm asking everybody to give us, your top 2 things that you think are the most important to do right now. That input's going to be important.
Quick follow-up, Mr. Chair. If we're going to be meeting twice a week, is it going to be possible to set regular meeting times? Because some of us, many of us, have other responsibilities, like being a healthcare provider.
Yeah. Well, we
supervised kids.
Right now. And we all are going to have those challenges. We'll do the best we can with that. We're really organizing this quickly with a
I understand. It's just a request. Right.
We will work our best at making it a regular thing.
I think we had a good test today with our equipment. It appeared that the people who were all around the state were able to join with us and make this work, and so it may be that will be more and more of us. on that screen and fewer of us in a particular location. That's going to be important to work on. I hope that as we look at the information that's been coming in and all the stuff that we got today, and we get it separated by the different groups as our LPRO people look at it, that might be one of the ways to organize around work groups and so on and so forth. So I think I agree with my co-chair that we need to work on it. I appreciate Senator Boquist for the request and the conversation. He touched about that before with me before, and I am pleased that he brought it up today.
So one more time, if you want to submit anything to the record for this committee, it is jscvr.exhibits@oregonlegislature.gov to submit any of your issues, problems you're seeing, or potential solutions or recommendations that individuals have. It's important that come through this committee so we can get it to the right discussion points. There's also ability to weigh in with your local governments and the governor's office on this as well, with their direct response team on many issues as well. So I just want to share that, thank the staff for putting this together, and really, you know, this is uncharted territory for a lot of us as we're going to probably move to more virtual meetings, I'm expecting. So appreciate that.
Who is that on the phone?
Lori would like to just say a very short comment, make a short comment.
Go ahead, we're waiting.
Can I go ahead?
Yeah, you bet.
It has been great remotely. I mean, you guys, I couldn't really see you, so I brought you up on OLS, but I could hear, I could see Sarah Gilser and Stark and anyway, but what I thought was important is I appreciate the governor reacting as well as OHA. I had 4 issues I really wanted to cover, and so I let them know ahead of time. In fact, Arnie, you were the one that told me to do that, and by gum, they covered each one of them. And so I just thank the governor and OHA for responding so significantly and getting the information that I needed, as well as then covering it in this meeting. I'm sorry I'm not there. I just am dying because I gave up my trip that I was supposed to leave tomorrow to Chicago, but of course can't, to be with my grandkids. But we'll share via Skype like we usually do. So thank you, everybody, and I look forward to the next meeting.
Thank you. If nothing else, I think that we will adjourn this joint committee on coronavirus response.
Are you taking a